Thank you for being here. It is now 10:01. I'm going to call this meeting to order, and I would like to ask Representative Groder if she would like to lead us in the pledge. Thank you. Thank you, everyone. I'm just going to read our mission. This bipartisan committee is tasked with investigating and evaluating the state's response to the COVID-19 pandemic. The committee will function in a science-based fact-finding review, specifically acquiring comprehensive, accurate data and all related information pertaining thereto. Areas of particular focus will include the administration of federal guidance, acceptance of federal funds, and implementation of emergency use authorization vaccination efforts. A report will be issued outlining the committee's findings and the impact on New Hampshire. Today, we have opened up for citizens from the state of New Hampshire to address this committee. And I would like to call Representative Horgan. Thank you.
Well, I'm Representative Timothy Horgan from Stratford County District 10, which is the town of Durham, as probably everyone around the table knows. Although I feel a little bit silly since only two people showed up, but I guess we're here. So I guess the first thing I was going to say, we hear a lot about other aspects of the COVID emergency, but the COVID-19 virus itself was and still is the deadliest respiratory virus in human history. So I say is because it's still out there and it's still being spread around. It's mutated into a less deadly form than it was 4 years ago, but it's still there. And the various interventions we tried here in the United States and worldwide to stop the virus, they weren't all 100% safe or 100% effective, but they were necessary and they mostly worked. I predicted we're going to hear a lot of talk about rights. I'm expecting a larger crowd. But anyway, there is no natural or inherent right to spread a respiratory virus. There is, however, a natural and inherent right to breathe. In any case, I just want to remind you of a few facts, and you've seen these before, but according to the CDC, as of April 27th, 2024, the total death toll from COVID in the United States was 1,190,122. And in New Hampshire of that same date, the official death toll was 3,516, including the Speaker of the House, Dick Hinch. And at the height of the pandemic in January 2021, the death rate from COVID nationwide 7.8 per 100,000, or one person per 12,850. So, and I'm not sure which New Hampshire community is closest to 12,850, but that was one person was dying every week amongst any group of people of that size. And one thing I mentioned is that death toll I just cited, which is probably a little understated. Is about equivalent to losing the entire population of New Hampshire. So, like, if everybody in the state died, obviously that's a pretty tremendous catastrophe. But that's how many people died. And just in the state, it's equivalent to losing the entire population of the town of Chesterfield. So, this is really the worst catastrophe in American history, with the exception of the Civil War. And we got off easier than both the other countries, and the pandemic was pretty bad, and it could have been even worse. So the three most controversial inventions, I think, were all mostly successful, which social distancing, that was painful. So I'm glad that we're meeting in person again, but it worked. And some of the hastily arranged workarounds we came up with, such as holding meetings via Zoom, are still used today, even 4 years later, after we've all pretty much pretended that COVID is not there anymore. The masks were uncomfortable. In my case, they always made my glasses fogged up, but they worked. Not perfectly, but they worked. The vaccines also worked. The vaccines, they've been blamed for just about every health emergency suffered by any individual anywhere on the planet since they were introduced back in early 2021. However, the relevant public health data shows that those vaccines were safe and effective. Not 100% safe, not 100% effective, but I believe but I know that they did work. So that's my testimony. I'm actually in. I think I'm probably in pretty close to the 3 minutes. So I guess
I'm not limiting you to 3
yes,
minutes.
we're not in any hurry. Are we? We've got all.
But will you take questions?
Sure, I guess so. Yes.
Does anyone have a question for Representative Horgan?
Oh, good.
Representative Belcher, please.
Thank you, Madam Chair, and thank you, Representative, for being here. You did note that there is no inherent right for people to spread a respiratory virus. So when a right is violated, that creates a cause of action for somebody. So are you suggesting that if somebody were to come into work with the flu or the common cold and spread that virus, that they should be subject to some kind of a lawsuit or criminal punishment for doing so?
Well, that's a hypothetical question, which I'll pivot a little bit into saying that the masks also actually reduce the incidence of seasonal flu and the common cold. And the seasonal flu in particular, we tend to take it for granted, but that's a major public health issue, and we haven't had we have a seasonal flu epidemics almost every year, but the ones that we've had over the last 4 years have been much milder, especially in 21 and 22. And that was partially because people were wearing masks. And of course, in 21 and less in 2022, they weren't gathering in groups as much. So those, as for whether there's lawsuits and stuff, I don't want to get into that, but yeah, thanks.
Follow up?
Thank you, Madam Chair. Yes, I just want to dig a little deeper into that because the idea of spreading viruses being a potential something that's not an inherent right for people, there is some precedent in law for that. Multiple places in the country have, for instance, they've criminalized knowingly spreading the HIV virus. Now, some places like California have recently worked to decriminalize that on various different ideological reasons. But are you suggesting that if there is no inherent right to be able to spread a respiratory virus, that we should take measures similar to places have done with HIV and criminalize the spreading of respiratory viruses, or creating a civil cause of action for people to sue over?
We're not the special committee on HIV response efficacy, although that was a problem in New Hampshire and everywhere else. Sexually transmitted virus, that's very serious, but a respiratory, that's an even more basic bodily function. So it's pretty much unavoidable. If you stop breathing, you die within a few minutes. So that's not that a sexually transmitted virus isn't serious, but like a respiratory virus, that's like even more serious and even more basic to our functioning. So as for the rest of it, we can convene a special committee on the HIV response, although HIV sort of, we got some treatments that work somewhat and some vaccines work somewhat, and we've pretty much forgotten that it happened. So thanks.
Representative Weary.
Thank you, Madam Chair, and thank you, Representative Horgan, for taking my questions. At the bottom of your testimony, you make several assertions about the effectiveness of three. All right. There it goes. All right. Thank you. Well, thank you, Madam Chair, and Representative Horgan for taking my question. At the bottom of your written testimony, you make assertions with regard to the efficacy or effectiveness of three interventions there. What's your basis for making those assertions?
Well, that's my opinion as a not totally well-informed, but reasonably well-informed citizen. I was a member of the House back in 2020, and there were a number of number of series of briefings, some public, some like a little bit less. So certainly with the vaccine, the public health community did try to brief, interested parties, including public officials. So I did get kind of I'm not a virologist or an epidemiologist, but I got somewhat, I did hear like almost every week about what was going on. And of course, I also watched the same televised briefings anybody could watch. That was pretty much all I did that's pretty much all I did for a couple of months back in 2020 when I was stuck at home and there wasn't much else to do, and of course, sometimes I wonder why some of those officials, how they had time to do their jobs. They're spending so much time on TV, including Governor Sununu and Commissioner Shibanet. They were on for like an hour every day, and it was good TV. But still, I wonder. I was amazed they had time to do their job. So I'll just say that's my opinion based on what's out there, and I'm sure when you issue your report, there'll be varying opinions on it. So I don't know if that's the answer.
Follow up?
Just forgive me, but as an engineer and as someone who has worked in the healthcare industry for 40 years,
Yep.
I just want to make sure that I understand. Is there any scientific or technical evidence that you can present to substantiate these assertions?
Oh, that wasn't the data exists. I was just here to issue my one-page opinion and speak for 3 minutes and then answer questions. So that's there's other experts you can call in if you want to call them in. So that's wish I had a better answer for you, but that's I will say I work with vital records a lot, and there were like more deaths than there should have been, and there weren't more deaths from respiratory disease than there normally should have been during the period from going back to 2020 and continuing even today. So I can tell you. I can tell you. So that's one area where I have a little bit more expertise than the average person, not as much as I should. So certainly, if you look just at that particular realm of data, yes, there are quite a few excess deaths. In fact, I think in 2021, the average life expectancy of Americans actually went down, and it wasn't due to the masks or the vaccines or any. So that.
Representative Chrétien.
I just wanted to jump into this. I mean, we've had a few other meetings where we've had experts testify at length to the efficacy of the vaccines. There's thousands and thousands of, scientific peer-reviewed publications that have shown this at this point. I'm not sure it's appropriate to be asking our testifier to come up with all that support. We've heard it from other folks.
Thank you. And Representative Grota.
Thank you. I would like to thank you for coming and sharing your thoughts. And I do want to remind everyone that this is a public comment meeting, and it's not meant to be questioning or cross-examining the people that come before us. And I appreciate your thoughts, and I appreciate everyone who comes and speaks before us. So thank you so much.
Well, thank you, and you're welcome.
And thank you, Representative Grota, for stating that fact. I appreciate that. If there's any other questions, and Representative Horgan, thank you so much for coming and presenting your testimony and sharing with us your thoughts.
Hopefully it helped a little bit, but thanks.
I appreciate it. Okay. The Honorable Betty Gay, would you please come up?
Okay, Betty Gay from Salem. Excuse me. I have to apologize. I just learned about your committee night before last. So I've been trying to remember the many, many things that were on my mind when we were going through this. And so my notes are not in order. I really meant to put them in order, and also to bring some written, the documentation where I got these opinions. Some of it is just personally observed. Others were things that I read. And my concern, I have actually many, many concerns. I really believe strongly that if we are faced with another situation like we had to deal with COVID, that we will open the lines of communication so that everybody is listened to and not ridiculed. Those people who had shared a lot of my opinions were shut down. We absolutely could not ever hear on national news what we had learned through study, finding studies that were being done, listening to doctors who were actually treating patients for whom it was not theoretical. If they didn't do the right thing, they lost their patients. And it was really wrenching. And some of them were ICU doctors, and they had to face this on a daily basis. They had to invent new ways of treatment. And just yesterday, I was listening to another video that is posted by Dr. John Campbell of England. He is a fascinating person. He is retired. He was a teacher of nurses, and he Zooms with people from, Australia, New Zealand, New Orleans, New York. So are people like Dr. Mobeen Syed, Dr. Bean? He's another person who's actually, he's a businessman as well as a person who treats people. And he's created like a medical school refresher course for people for a very modest fee. For like $75, you can have a membership and look up anything. And he does all these drawings. I mean, the guy is a genius, and I really appreciate that he gets other people on there, so you're not just listening to him. Like Dr. Paul. Oh, well, here's my apology. I don't have this all in order. It's like a patchwork quilt. So I'll just keep giving you things. If it's interesting, you can say, I'm going to ask her. She has to document this. But like I said, I really intended to bring the papers that I put together a couple of years ago so that you could look it up for yourself and make up your own mind about the results. I'll see if I can read some of my notes. The overall conclusion I came to was that the next time a communicable disease is identified in New Hampshire, I want to see medically responsible interventions to be practiced. The unscientific methods applied last time caused thousands of susceptible people to die. Now, that's a pretty serious accusation. They were either frail or deficient in immunity. They could have been hale and hearty, but like I saw one man interviewed on TV, he was a nurse. He was Black. He was in a southern state, and he was documenting day by day his fighting the illness. Well, I found out later through my reading, one of the things that was against him, otherwise he was hale and hearty, he's likely very low in vitamin D. The darker your skin, the less likely you are to absorb sunshine and make vitamin D. Vitamin D is a really hot topic because it used to be that 30 nanograms per milliliter was considered very high. You didn't want to go above that. But somebody it was in Asia, and despite the real impact of the study they did, I had a really hard time finding out where they did the study. But this person went to 4 hospitals in their area so that they could find 50 patients who had very light cases. And I assume that was in Asia because in Asia, they're much more likely to put you in the hospital for something you could do at home. In Japan, they don't even want to send you home if you're on crutches, if they know you're by yourself. So it's different attitude from the way we handle people and assume people can be self-sufficient. So anyway, they found 50 patients who had very mild cases, 50 cases of people who were at risk of dying. They were so sick. And then 50 people in between the two. And they measured their vitamin D level. Guess what? The people who were extremely ill had less than 20 nanograms, tested at less than 20 nanograms per milliliter of vitamin D3 in their bloodstream. The people who had extremely light cases measured over 30, and the people in between was proportional. It's not 100%, but it's 90%. It was really convincing. And so I got really interested in studying vitamin D. And there's a huge range of what people think is appropriate. Some people think the high number that you shouldn't go over is 100 nanograms per milliliter. So I myself took enough. It doesn't matter how much you take, it's how much your blood has in it. So the only way to do that is to be tested. So when people say, oh, I take so and so, and they think that's it, no, you really need to test it if you're aiming at a healthy goal. One of the things that was just amazing, I accidentally picked up a newspaper that had been sent to me, thinking it was a local one, and it turns out it was one from a company that's famous for its nutritional studies and selling nutritional things. Breast cancer is known as the low D illness. And that's what's confirmed to me by other people, friends of mine, who've been fighting breast cancer for many years. And this article confirmed it. It said that people whose blood level was over 65 nanograms per milliliter, their percentage, I'm not sure how to say this, their risk of developing breast cancer is reduced by 87%. My husband, who is a cancer survivor of salivary gland cancer, I said, hon, do you want to read this article? He said, no, I'll just take the D. So it's really easy, it comes in really little bitty pills. And through some of the studies that I can send you when I find it in my pile of papers in my office, they found that D2, you can also take D2 because our body changes it from the time it makes it, from the sunshine on our skin. It goes through multiple conversions. And if you take the D3, you're the closest you can take it that's quickly used by the body. If you take D2, your body has to convert it to D3 first. So it delays it another day or two. But it's all inexpensive, incredibly inexpensive, and tiny little pills. You can get them in oil-based pills. You can get them in solid pills. So I've been trying to gently tell people if that's an option they want, it's really easy to do and inexpensive. They found in Spain and in France, I found articles about one nursing home in each published an article. They've heard about D being protective. Well, nursing home people are pretty frail. And so, I'm glad they were trying to be proactive to protect their people. So they gave them, and they call it bolus. I guess when you do a bolus, any kind of thing, it's a pill. We're giving, instead of in your food on a regular basis, we're going to give you a dosage. And they found that the people that they gave it to, their statistics, even though that we're talking about small numbers, statistics should be in the thousands. They're talking about who's in their nursing home. It was profound. Nobody they gave the D to had to go to the hospital. Nobody. And their time that they were ill, if they were ill, was very shortened and not life-threatening. Okay, so all of these studies that came out, the only way I found them was looking them up online. I never saw anything like this on the news. On the news, we knew counts, the number of people. Then we found out later, many months later, that the hospitals knew that they got a lot more reimbursement for treating people if they were being treated for COVID. I'll just say I'll identify the elephant in the room. Lots of people were diagnosed as having COVID who didn't have it. And I've heard lots of people who worked in the hospitals say that. So this is my opinion. I really, as a scientist, I only have one degree. It's in chemistry. So I took biology and chemistry and physics, and don't test me right now because it was quite a while ago. But it means that I was trained in the scientific method, and you don't just take the word for somebody because they observed something happening. That could be out on 3 standard deviations out. That could be you want to see enough data to draw a conclusion that the cause really did tie to the effect. But when people are dying of an illness, and you have people who are getting very mildly ill or not ill at all, to me, that needs to be investigated. But I didn't see anything in the news that said anybody was investigating this. In India, let's see, I have to back up. I can't remember if it was 2020 or 2021, that somebody thought to check ivermectin. It's an old medicine, 1970s. It was developed to treat as a substitute for chloroquine, which was then refined in the 1930s to hydroxychloroquine, which is to kill parasites, either to kill them or to prevent them from taking over in your body. The most famous one, of course, is malaria, but in the 1970s, ivermectin was deliberately studied to try to kill river blindness, because where people live where the water is dirty, that's a very common cause of blindness. And preventing it, finally in 2015, won the Nobel Prize. Meanwhile, after we learned that Dr. Pierre Corey and Dr. Paul Marik, M-A-R-I-K, Dr. Corey is from the U.S., Dr. Marik is a U.S. practicing ICU doctor, just like Dr. Corey is. But by his accent, I'm going to guess he's from South Africa. They heard about ivermectin being used in a test tube. Well, what could kill the COVID was higher concentrations than what people could tolerate. But people take ivermectin all the time. If they have a skin, let's see, what is that called? I listened to and watched on a video a doctor in Toronto who was learned about, she has her own, I'm sorry, I'm such a rotten speaker. I do my best, but it's not good.
You're doing fine.
Okay, thank you. She heard about this amazing thing that happened in a Toronto nursing home. It was a really big one. It had four floors. And they had an outbreak of, and I cannot remember the name of it, but it affects the skin, and it is a parasite. So they treated all the people with ivermectin. That's what it's for, parasites. And then just to hopefully stop it from spreading to the other floors, they gave lower dosages to everybody, not the staff, the people who lived there. Then some staff person brought in COVID. Guess who got sick? The staff. Guess who didn't get sick? None of the residents. Don't you think that's newsworthy? They did their best to call the TV stations, the radio stations, and offer to be interviewed because it was so profound. Who came and interviewed them? No one. Now, to me, that's criminal. That's another elephant in the room. You're not supposed to say anybody did anything deliberately wrong. But that was so earth-shattering. And one of my friends who died early on was in his 80s. He was frail. He was never offered anything. No hydroxychloroquine, no ivermectin. Well, they didn't even know about ivermectin early on. But the other, well, I could go on for another couple of minutes. The FLCCC, Frontline COVID Critical Care Alliance, was founded by Dr. Corey and Dr. Merrick and some other brave doctors who signed on. And they were actually treating patients. And of course, they didn't get patients until they were deathly ill because they treat in the ICU. So anybody they were able to save was remarkable. They were repeating, their work was repeated by a doctor in Pennsylvania. They had a woman who was hanging on to dear life on a respirator for days, and her family heard about ivermectin. So they asked the doctors to give it to her. They said, no, we don't know about it. We're not going to use it. They went to court. Luckily, they were able to get a court hearing within a day. The judge said, give it to her. They did. They gave it to her one day. The next day, she was off the respirator, sitting in a chair next to her bed. Now, if that's not newsworthy, I don't know what is. So then she was better, so she didn't need to stay in the ICU, so they transferred her to another part of the hospital. They said, keep giving her ivermectin. The doctor said, no, I don't believe in it. Again, they had to go to court and force him to give it to her. And she did recover, and she did go home. The same thing happened in New York. But how many people, number one, had the information because it wasn't in the news? And how many people have the wherewithal to go to court and pay for it and find an attorney and get a judge who is open-minded and willing to give people a choice? In India, when they learned about the ivermectin, most of the states, India has several states. I have no idea. I have no memory of how many, but they have many states. So each state makes up their own mind. So the person who is head of the national health, whatever agency that's called, recommended the ivermectin. So all states but one gave it out for free to their people. The incidence of COVID dropped. The one state that didn't, it didn't drop. Then the person who was in charge nationally left, and a new person came in who was listening to the popular opinion. She banned it. Can't give it out anymore. So the COVID incidence climbed right back. Fortunately, somebody said, we can't do this anymore, and overruled her. And again, they were able to suppress the outbreak. I heard a man who was visiting different hospitals in different countries. He went to Brazil, and he was used to going to hospitals and seeing how they were treating their COVID patients. You know, what's the report from them? So he went to one, and he said he wanted to go to the COVID ward, and they looked kind of askance. And he finally found out they didn't have one. They were giving out ivermectin, and they had no patients at all. So despite this really great success that was experienced in several places, it was not carried on the public news. You had to find it by looking for it. I find that absolutely reprehensible. This sounds like the people were listening to some very strong financial guidelines. And again, I'm going to say this is my guess. I don't want to say this absolutely, but the same people who made remdesivir, which had been developed to treat Ebola and didn't work well, so they lost a lot of money. It costs a fortune to create a drug and to test it. It is really, really a deterrent, and that's why it's a deterrent to FDA accepting new medicines, because you really have to be a huge company to pay for what it takes to get approval. So some of the really good medicines are not FDA approved because they've been recognized and found by companies that don't have that kind of money. They're doing studies on L-serine over at Dartmouth Hitchcock for treating neuronal diseases, and they need to find somebody who can put the money up for the second and third tiers of testing, which has wonderful opportunities for ALS and somewhat to Alzheimer's. But that's another story. But that just shows you that we really need to come up with rules that allow people, give people the right to try medications. And sadly, that was only a presidential edict. What is the term? Executive order. Yeah, we really need that to be a law. Maybe that is, but I hadn't heard that it passed. I was really, really upset. I guess it doesn't matter what my emotions were, but I thought it was absolutely wrong that not only were these success stories not publicized, the medicines were accused. The people who proposed using the medicines were ridiculed. Massive amounts of news were spent to deny the legitimacy of their work and to deny people the right to try. I called every pharmacy that I could find listed. So I started with the pharmacies that are national, the chains, the CVS, the Rite Aid, the Walgreens. I called everybody. Then I called the individual privately owned ones to find out how to get ivermectin. Every one of them said, you can't get it unless your doctor says it's for parasite treatment. If they say it's for COVID, we can't fill it. Now, the CDC has finally been found against by a federal court that said, you can't do that. You can't make up, you can't decide how people are treated. But that was in effect for a couple of years. The only way you could get ivermectin was to buy it from another country.
Do you mind if I ask you a question real
Oh,
quick?
gosh, no.
Something you just said a little bit bothered me. You were saying something about the CDC was telling pharmacies what they could and could not. Could you just repeat that, please? Thank you.
Yes, it was a decision just in the last couple of months by a federal court. It was a suit brought by several doctors who wanted that overturned, that the CDC could not keep telling them that they couldn't treat people with ivermectin.
Do you mind if some others ask you questions?
Oh, gosh, no, this will be very helpful.
Representative Weary?
Yes, thank you, Madam Chair. Could that possibly be the FDA, not the CDC?
It could. Isn't the FDA the parent and CDC is under it?
No, they're
Or is the other way?
They're distinct organizations.
Oh, okay.
I think it's the FDA, because just a quick Google search talks about FDA and ivermectin and court rulings. So,
Thank you.
Just to clarify that on your testimony, I think you meant the FDA and not the CDC.
Yes, thank you very much.
You're welcome.
What month was that? That was this year, wasn't it?
There is always a trustworthy source, CNN article on FDA settles lawsuit over ivermectin content that doctors claimed about that. So that was published March 27th, 2024. So you're spot on with your testimony, but it is the FDA and not the CDC.
Thank you.
You're welcome.
Representative Potenza?
Yes, I'm very familiar with the court case, and I'm glad you brought that up, because that was we both kind of raised our hand at the same time, because the FDA, of course, is like the controlling agency. CDC just gives out kind of the guidance and stuff. So are you aware that, because I know you said you did your own research, I did that kind of research as well, that there were, because I have a lot of friends that have been taking ivermectin for a long time. So before COVID, I was kind of, my thing was tick-borne diseases. So I was very familiar with pharmacies that prescribed it, and even a major chain. So that completely switched. And so based upon your research, my research was the same, and it wasn't just mine was local, of course, New Hampshire and in Maine. So that's kind of how the only place that I knew that was still, in a sense, filling those prescriptions were for friends of mine that had been on ivermectin for many years because of treatment for tick-borne diseases, babesiosis, Lyme, things like that. So, did you see of any, I did see a couple compounding pharmacies, but they were a little nervous. So I'd love you to see, there was a compounding pharmacy in Nashua that was still filling, but it was almost impossible to get it, as well as hydroxychloroquine, which, I'll speak on after. I would like you to talk about that, just your experience and your research, because I have the same.
Thank you very much. Hydroxychloroquine, again, was developed to treat parasites and had a long history of success. And I give great credit to people whose lifetime, like Dr. Corey, is to try repurpose old medications. For one thing, they're safe, so that's a really great place to start. Chances are they're inexpensive because everybody knows how to make them. So the tragic thing that happened with hydroxychloroquine was that in this concerted effort to allow experimental drugs and experimental shots to be given, they had to say there was no treatment. And so it was in financial best interest for the people who were selling these other treatments was to say there was no treatment. So hydroxychloroquine, all you had to do, and I read that advisors to President Trump said, well, he said we had to do this, so we're going to make sure it doesn't work. You're going to do studies with hydroxychloroquine on people who are in the hospital with COVID. It doesn't work then. It only works in the first few days before the illness has triggered the response to the poison in your lungs. And I just yesterday stumbled on a study that was reported by Dr. Mobeen Syed and Dr. Merrick, that for the first few days, for about 5 days, that's when you can kill the germ, the virus. But then it dies. What's killing people is the resultant poison that they've produced in your body that attacks the lining of your lungs. And in fact, Dr. Corey at first got a lot of pushback because he said, it's after the first few days, you can't even wait very long, but you need to be treating people with the anti-inflammatories. What is the real famous one? It's, you could give it to somebody out of bee sting. Yes, like prednisone and all these things similar to it. You've got to treat it. It doesn't do any good to a person whose lungs are being attacked to give them an antiviral. That's not what's killing them. It's their lungs. And I had heard that a few years ago that people now with real serious pneumonia and things like that are treated with those that type of medicine. And I wondered why, because doesn't kill germs, but it's because COVID victims, the germs have done their duty and they're gone. You need to kill them right away. So It's just every single thing I learned pointed out that we weren't doing it. That if we listened every day to the reports, it was a body count or count how many people were sick. So it didn't, I never heard anybody recommend that we get our immune system boosted.
Representative Chrétien.
Thank you so much for your testimony today. I definitely, by trade, I am an editor of scientific manuscripts, so I definitely appreciate a lot of the things that you're saying, and agree with a lot of that we need to do things to, I guess, boost our ability to do research and do good, high quality studies, and then also improve our ability to actually communicate that information out to folks. So. I guess just digging into, I think, the themes of a couple of the things that you were saying is that we need to be able to do this research faster, and then we also need to do more with communicating. So I guess connecting it back to the function of this committee in terms of how the state could have responded, are there things that you think either the state of New Hampshire could have done better to, be looking at that research and communicating that out to folks, or how could we prepare next time to be able to do that while still remaining within the guidelines of ethical experimentation on people?
Well, I think just being honest and open the dialogue so that people weren't silenced, so people weren't ridiculed when they said, oh, we have an idea and this is working well for us. We should have said, let's have some forums. Let's have weekly forums on what's working. And what have you heard? Like all the people, I can, I've mentioned many articles, and I can go dig them up so I can let you look at them and see which ones you think are real impressive. That's the most important thing, that it looks like they did a good job. And so their data is worth repeating, because that's what you want to do. You want to repeat the good stuff and see how consistent it is. That's the scientific method. But what we need to never do again is shut people up. We don't like what you're saying, so we're not going to give you any coverage. We could have had forums. I'm sure we had, because we would just hear, like on the grapevine from a friend, oh, Dr. So-and-so will order the ivermectin. But look what happened to the doctor in Maine. They took her license away. And when she was being queried, maybe I'll think of her name a little bit. Maybe you can look it up. But I actually was able to thank the head guy at the organization that provided the money for legal counsel for her, because in Maine she was queried. She tells the truth. They said, "Did you order hydroxychloroquine for a COVID patient?" She said, "Yes." "Did you say it was for COVID?" She said, "No," because they wouldn't have filled the prescription. So on that basis, they took her license.
So it seems like, and I don't want to put words in your mouth, and it seems like what you were saying is that based on your studies, that ivermectin and hydrochloroquine were prescriptions that were found to be effective against COVID. But in order to get them, the doctors had to lie about what the prescription was for in order to treat their patients. Is that what you're saying?
Yes, but I only knew of one doctor who did it because the rest of them didn't want to lose their license. My own practitioner had told me in May, when I went for just an annual checkup, I asked her, I said, if I get COVID, would you order ivermectin? She said, yes. In September, when I called all the pharmacies, I had found out from her she was forbidden to order it. So all I could see was a massive power grab by people who could influence lots of people. And so that makes me think it's the richest people in the country who fund research, who fund the CDC. They're majority funders of the CDC and the FDA and the NIH. I always thought those were government agencies that were government funded, but they receive like 50% of their money. 30 to 50% of their money comes from pharmaceutical companies. So naturally, that's going to put some pressure on them to keep the pharmaceutical companies happy. You wouldn't want to lose your research money. You're knee deep in it. You've got to keep going.
Representative Belcher, then Representative Cretian.
Thank you, Madam Chair, and thank you for being here and providing your testimony. I'd like to drill down a little bit on the issue sort of surrounding ivermectin, and I'll sort of frame the question like this. Now, I don't really know whether ivermectin works. I took it once when I had COVID. I don't know if it did any good. Looking at the bulk of the evidence for it, some people might be surprised to say that I kind of lean in direction of it probably not being effective. But I also see all of that as kind of an aside point, because the way that we've sort of done business as far as practicing medicine in this state and in this country for a very long time is the decentralization of authority. Physicians regularly, and they're allowed to, prescribe medications, even off-label. So if it's not necessarily FDA approved for a certain cause, we kind of get out of the way as the government and say, okay, well, physicians are the ones treating their patients. They have the authority to do the thing they think is going to be effective with, discussing it with informed consent with their patient to prescribe something off-label. Maybe it works, maybe it doesn't. But I think the question is, who gets to decide that here? So would you, given your testimony, would you be supportive of this legislature looking at ways to protect the authority, the decentralized authority of physicians, as opposed to sort of more of a central planning, saying that in an emergency, it's okay to sort of take that authority and centralize it and say, we're going to control everything that's done from this one location? Is that something that you would support?
Yes, it would have to be written extremely carefully, because I'm sure everybody sitting here could think of dangers. If any sentence you put in there could end up being harmful. So yes, it would have to be, but I would definitely think that right, which is practiced, off-label is really common. I read a number that was like 40%, that's pretty high. But I'll tell you what happened. The very first person that I learned about being told, no, we'll tell you what you can do. You'll have to look her up for me. Simone Gold. I think it's Simone. Its last name is Gold. She was a physician in California, and she apparently had already treated people who had had SARS, because I think it was 2010, we had a SARS outbreak. Thank you. Yes, yes, 2010. And they found hydroxychloroquine worked for that. So she was presented with her very first case of COVID, and she ordered hydroxychloroquine, and she called them the next day and found out they were much better. And then she got a call from her boss, who was not a medical doctor. Her boss said, I understand you ordered hydroxychloroquine. She said, yeah, I did. He said, you can't do that anymore. She said, I'm the one who's responsible for treatment, so yes, I need to order that. So she didn't give it another thought until the next day when she did it, they fired her. So she formed AFLDS, and I'll be hard-pressed to remember all the words. American Frontline AFLD. Doctor. Yes. And she has what's the right word? She has led it as not only are we talking about medical freedom, but just freedom, period, to have the government intervene so seriously and deny your rights to be treated. So one of the first laws I'd like to change is make sure that patients have the right to try, and that likewise, the doctors have the right to prescribe. And suits will take care of that, because if somebody orders something outlandish and it hurts people, they are gonna sue. So,
Representative Cretian.
Thank you again. Thank you for taking more of my questions. Actually, I have two, if that's okay. I guess my first question is, so thinking about the right to try, like to try drugs, I definitely am in support of that. However, I do have the concern if, for example, some popular podcaster recommends a treatment with dangerous side effects that's not really supported, but he's got a lot of listeners. They all are very interested to try something. How do we protect people from that sort of situation while still maintaining that right to try? Like, who gets to make that decision of, yes, you can try this versus, no, you can't try this because it's dangerous.
Well, my opinion is we try to educate people that anytime somebody's recommending that you take a medicine, that you look it up and look for the contraindications. I learned that was a good way to do it. Instead of saying side effects, put the name of the drug and contraindications. Because lots of good drugs that people use all the time definitely have contraindications, and people should just get used to checking it out. But that's the person's personality, because some people much prefer to do it themselves and research it, and other people really want somebody to take that off them and just tell them, So we can't change people's personality, but we can do the best we can to educate people that is a responsibility they should assume.
Can you take a second question? And then I guess just going back to what you were saying before about, the different funding of the NIH and CDC and all that. Would you support increasing that funding at a federal level so that, do you think that would help with bias if we were funding more things, federally versus having to rely on private donations?
Yes, and I think that should be very public knowledge too. How much funding comes from Congress and how much funding comes from people who have a very vested interest in their decisions. That reminded me of another, it slipped, it'll come back. A related subject.
Thank you. Well, we're on the same page as far as that. So thanks.
Representative Potenza.
I wanted to go back to just a couple of things and bring this all to New Hampshire, of course, because that's what we want to, focus on. So I assume that you're aware early on in the pandemic in regards with what the state did, DHHS along with the governor in restricting their emergency order about hydroxychloroquine, correct?
I can't remember when the sequence, because all I know is that it ended up being forbidden.
Correct. Yeah. So that was in, and I'll provide all that documentation for the record. So just so we have that, because it was, it was a really big deal, and it happened in April. It was early on in 2020. So, and that was based upon saying that they didn't just do it, of course, for hydroxychloroquine. They also did it for albuterol, thinking that there was going to, be a shortage when there was never a shortage. That's a medication that is ridiculously in abundance. So, so I just was wondering if you remembered that. Also, in regards with right to try, because I believe that is the key legislation here. I worked with 2 lawsuits in New Hampshire for folks that were asking for the right to try for their loved ones that were in the hospital, and one made it and the other one died, and we were both denied that right to try. So this is a very intimate topic for me, and hence why I wanted to be on this committee. So there is a family that I wanted to know if you remember, because we had a mutual relationship with them. It was a hospital in southern New Hampshire that I wanted to go back to what you talked about specifically. Remember, you were talking about how hospitals needed to get that kind of COVID test, positive to be able to, they got expanded money, and we do know that, that there was a mutual family that was admitted to a hospital in southern New Hampshire. They tested for COVID, negative, tested again, negative. third time they got that COVID positive that they needed. Never really treated him for anything. He had breathing issues, but it wasn't COVID, and he died in a week. It was awful. And that family was denied the right to visit and all that. Do you remember who we're talking about?
No, but I had another.
Because you were in the legislature at the time. And so, and I remember you being on the committee, and I remember coming to testify. So just,
I'm very, very glad that you're on this committee because you'll have more to testify, excuse me, than I do. Just because I think all your data is going to be very well, you'll have a good bibliography. Now I need to go find mine so I can give it to you. I had a friend, she was an acquaintance. She was a lovely woman who worked at the local post office in Salem. She was in a hospital in Boston. She got sicker and sicker. She was denied that treatment. She was also denied, they banned her family from removing her and taking her to another hospital. Again, that killed her. I can still see her. I can see her without even closing my eyes. It still breaks me up that this person died needlessly. But some kind of really, I just suspect that it's some kind of really strong financial interest powered people to make rules that were unconscionable because they didn't want to lose their funding or they didn't want to lose their job, all because people had power that they shouldn't have had. So I think education, open communication is the real way to solve any kind of problem. You need to be open and listen to everybody. And if they make sense, then people will adopt it. And if they don't make sense, at least they were heard and evaluated.
Follow up?
yeah, just all of the research that you did in regards with off-label hydroxychloroquine. I have that too, but I would really appreciate if you could provide all of that, your research that you did, history on even ivermectin. I do know a lot about hydroxychloroquine. My husband took that prophylactically and never had COVID. And it was like a force field around him. When me and my daughters had it very mildly, because we're O blood type, which is another study that never came out, and that I would love to talk about, or somebody to talk about. But in any case, I would love you to provide all of that stuff to the committee. And I appreciate fellow representative that asked you about, just some podcaster that says, hey, this is a good treatment or whatever. That has to be clear. We're not talking about, because the information that you're talking about are drugs that have a long history and used in other countries that were really not affected by COVID and so I would love you to provide that kind of history, research that you've done about hydroxychloroquine, whether it be ivermectin and certain off-label drugs that had been used, repurposed for decades that we know a lot about. So thank you very much.
You just brought up another really great, is that okay if I say? You just brought up another really wonderful fact that was never promoted. And that is that really poor countries where they give people prophylactic, just like in India, they did it because of COVID. There are people in the poor countries in Southeast Asia and in Africa who take ivermectin on a regular basis, and it's not every day. It's like, and maybe it's hydroxychloroquine too. They take it maybe. Well, some people. One of the studies I read, they were talking about one of them, so I'm not sure which one it was. They take it 6 months apart, just a dose, maybe a couple of doses, and then 6 months later take it again. Those people had hardly any COVID. The poorest of people didn't have it, whereas Europe and the U.S. with lots of sick people with lots of money had it.
Representative Weary?
Yes, thank you, Madam Chair, and thank you. First, just with regard to hydroxychloroquine, I've traveled to India a lot, and so I've had to take it prophylactically, um, and um, and have watched a number of colleagues take it prophylactically, and I think the only problems that one individual that I knew had with it was that he had been going for an extended period, and so had some blurred vision issues, which is one of the side effects commonly listed for hydroxychloroquine. And so it alarmed me when I started seeing reports that um, that were being put in the news that this caused heart attacks. And um, so it brought up, which my colleague had mentioned before, the risk-benefit ratio, I think is part of this trifecta or trifold thing. Is we want to balance a patient's right to try, we want to balance healthcare practitioners' off-label use and the right to practice medicine as they've been trained to do. And then we also want to carefully balance that risk-benefit ratio where you have, I think, a hydroxychloroquine and ivermectin ostensibly have extremely low risk to the people consuming it, and a potentially, given the nature of COVID, a high benefit. And so to suppress something that has that kind of ratio of risk benefit seems to me to be, well, not only tragic, but borderline criminal, if not criminal. So I think in trying to govern or kind of find where we want to make some recommendations, I think you've helped us really define that sort of sweet spot between those three factors in your testimony today. I think it's been very helpful. And as a chemist, you're probably a little better educated on some of these matters than the typical consumer. Any advice for how you would communicate, besides having them read contraindications off a patient, package insert or something like that? How would you try to better communicate the risk-benefit ratio to the average consumer?
Forums, all I can think is that people who are interested in the subject should volunteer, and we should support public forums. Because then if we gave some acknowledgement that that's important, the news media might ignore the fact that a lot of them are dependent on ads by pharmaceutical companies. I mean, I feel like I'm being crass to say this, but I really feel money had a lot to do with the decisions and the policies that were made, because we had news media that really, if you count the ads that you see on TV, lots of them are medicines, lots. So their income, if you make them mad by saying something critical, or saying, well, it's going to be critical if you say, if you contradict what they're saying, because that was pretty bad that you had to go to court and finally in 2024 get a legal decision that a government agency can no longer tell you what medicines you can take. That was a lot of people who were strangled by the financial power of the pharmaceutical companies. And I'm dependent on pharmaceutical companies. I take L-thyroxine every day. Aren't I lucky to live in a country where that's really cheap and available? And my life would be awful without it.
Representative Groda.
Thank you. First of all, please accept my condolences for the loss of your friend. And I'd like to focus a little bit on the idea of a forum, because I think that brings it back to New Hampshire. Can you share with me your thoughts on that, and how, what is your vision for that forum, and how do you think it would benefit the state and Granite Staters?
Well, good health for our people definitely benefits all of us. I haven't thought about how to put forums together, but all I knew was that it was so strong in my thoughts. These people that we need to hear from are being silenced. They're not being given a microphone. So I'm sure other people can help think of, it can't just be top brass talking. I really valued the opinions of people who were taking care of patients, the ICU doctors who were being ridiculed, whose patients were living and surviving. To me, they were the ones we should be listening to, not some guy in an ivory tower making, what, $500,000 a year on his patents. Huh. I want to hear from everybody. If the people in the ivory towers are saying wrong things, then the people who are actually treating patients are going to refute that. But they have to be protected, right? The way it was, they had already been threatened with losing their license if they ordered those two medications. So how likely were they to say it publicly?
I have a follow-up question. So aside from the ivermectin discussion, I mean, this is just I'm just talking about how do you or how do we as a state use what's happened in the past so that if something happens in the future where we have some robustness to our process. So don't forget the people in the ivory tower, forget all the money, I'm just talking about the basic grassroots forum and how that could happen and how that could fit into the whole landscape of emergency response.
Well, of course, I wish the emergency response had been encouraging people to increase their immunity, because most Americans, whether they live where there's lots of sun or not, are low in D. The people who live, I just went back and visited my family and friends in Texas. They have lots of sunshine. They also, because of it, have lots of air conditioning. So that doesn't mean they're out in the sun. Yeah. People need to know what their level is if they're low. It's really shocking to me. It was a pleasant shock, but it's still surprising that vitamins still are profoundly now being connected, our lack of vitamins are being connected to serious illness. And that's a shock, because I just guess I grew up thinking that you needed some really sophisticated medications to treat. Never even thought about prevention. And gradually, from learning from other people, I take lots of vitamins. And I'm lucky enough to be able to afford it, because it really is expensive if you take as many as I do. But most people could afford D. It's really cheap. Most people could afford C. I just think education and open communication, so we could pass laws to make sure they don't get shut down again. That's the major thing that I'm thinking of right now.
Thank you very much.
And thank you, Betty. And I love the idea of a forum, but I'm going to play devil's advocate here.
Okay.
If we did create a forum, knowing what we know, and doctors being afraid to lose their license, how likely would they be to share in a forum?
Not likely.
My other thing is the importance of vitamins on our immune system and helping to fight off diseases and viruses, and obviously vitamin D, extremely important. I know that my family, my boys are now, they're taking it in a liquid form. So it goes directly into their bloodstream because they found that they were low in vitamin D. But I don't know if there is such a thing, but having a pamphlet or something on the website of HHS telling, talking about vitamins and how important they are and what they actually combat, so people can understand that, vitamin D, yeah, you can get it from the sun, but you don't necessarily, you might not be someone who absorbs it. And if you have enough vitamin C, it can help combat these different ailments. So showing them what the benefits are of doing something like this would make people more apt to pay attention as opposed to not. Just a thought on that. What are your thoughts?
Oh, I think that's a great idea, because you're never going to have to worry that you're putting down, that you're, let's see, extolling the answer. This is it, which is really my criticism of what we were given when we were going through COVID. We know everything. This is what you have to do. This is the only thing that'll work. We're not really interested in what you have to say. So, but you can give people all kind of information and encourage them to do their own studying, so that you're not saying, oh, here's what we recommend. This many milligrams of C, this many milligrams of E, this many milligrams of D. If you recommend it and then always say, you encourage people to do their own research and see what works well for them, I think you protect yourself and you're honest. Never just saying, this is it. I guess that was another thing that just hit me, and I never had the words for it. I'm getting told exactly what I have to do, even though I can't discuss it. I'm ridiculed if I disagree with it. The very idea of shutting down all kind of businesses and then choosing a few that could stay, and then giving some money hoping to make up for the money they lost. That should have been people's choice to go. Yeah, what stores to go to, where they felt safe.
Right. And I totally agree with you, and just want to go back to something that we need to also educate people that they need to be responsible, take responsibility for their health. I had just contacted a doctor about something, and she's like, well, I think, maybe a dose of steroids. And I'm like, yeah, no, we're not going to try that right now. But it was open communication. We were able to discuss it. I know what the side effects are, and it wasn't essential. So it was a good back and forth, and it was ultimately my decision. Mm-hmm. And I think being able to be a decision maker in our healthcare, which seems to be one of the things that didn't happen during COVID. We were told what had to happen and what couldn't happen, and being responsible adults, and knowing our bodies, because everybody's body is different, reacts differently. Some people are more aware of what's going on with them, other people aren't. But I think that there has to be a give and take, and a one size fits all is, in my opinion, is never the solution to anything, because of diversity. What are your thoughts on that?
Of course, that's my philosophy too. And we like to think that you can make people do things. A doctor can order whatever they want. The patient may never take it. So ultimately, patients always have the choice of not following. It's just they don't have the choice of getting medications that they think they need if they can't find a practitioner willing to order it.
Representative Potenza.
So would you believe that when patients were in the hospital being treated for COVID, that when loved ones asked for infusions of vitamin D and vitamin C and other supplements, that they were denied? Are you familiar with that?
Yes. I
Okay.
was amazed to find out how amazingly infusions of vitamin C have saved people from what's the illness where your blood system, what is the word? Anyway, it's can easily be fatal, and your blood system is just infected. Mm-hmm. And it's just amazing. And so if you have a doctor who's willing, who's never done it, but is willing to go and see what other doctors have used for dosages, to me, that's a good doctor.
Yeah, so that right there, those denials of basic things that we've known, same thing, forever, right, were maddening. That it was really difficult. I do want to go back to the supplement piece because I think that is so important. And, I think that we have to, if we're going to really focus on health and immunity and all of those things, I know, and there's probably other people here that have children as well, that when I've brought my kids to the pediatrician, they always ask what they're taking in regards with, they want to make sure that they're taking vitamins, especially D and C and a multi and all of that, because there's no possible way that you can get enough from intake of food during the day. And in regards with public forums, that's the other piece that's so important too, because there's a lot of them. Like I've heard, we've had, Health Freedom New Hampshire is one of them. There's a Rise Up New Hampshire group that's further out, and they're like in the Keene area, that have done forums about this stuff as well. Many natural doctors, but many traditional doctors too, especially that ones that are treating with children. I've noticed that they've always been on that path. So it would be really nice to have the upper echelon, whether that is like, a DHHS or whatever, that is truly promoting that as well. So I just, there has been forums. It's just not in that mainstream. And I think that's what we all kind of are talking about here. How can we make that be mainstream, right? I mean, because this information is out there and we kind of gravitate towards circles that are giving it. But there's been a recent study, in a sense, in the last year that came out. It was huge. It talked about niacin and vitamin B being a huge fighter for COVID, in addition to stuff that we already knew from vitamin D. And it was just so sad that that's not mainstream.
Right.
So,
We just need to make more educational opportunities and make it, but giving our blessing as a governmental agency, I think does boost the approval and acceptance that it's an important subject. So I think we have the information, but most of us haven't heard it if we didn't have much time to dig. In COVID times, we had more time than we knew what to do with, because we were so prevented from doing other things. But mostly in a busy life, you really need to know that somebody has given their stamp of approval. This is a good website to look at, or on the news, they actually cover people who are making great strides, have noted that people are healthier. Anyway, positive information about things we can do.
Do you have anything else you'd like to add?
No, I just really appreciate that y'all are so interested and that you volunteered for this really, really, really important committee. I think it's absolutely, we're not blue or red on this subject. I think we all really care to improve the health of our neighbors and to make sure that our laws really support people finding out what they can do to help their health. And nutrition is really big. And a lot of people get scared when you say nutrition. It's like, now I'm going to have to give up all the things I really like to eat. So anyway, thank you so much. I really appreciate it because I've really felt bad coming in not prepared with anything in good sequential order. And but I was dying to come.
Well, thank you for testifying. And if you could email the committee your documentation, that would be wonderful. That way
Look.
Thank you. Take your
Thank you.
time.
Thank
We
you.
have time.
Okay. Thank you very much.
You're welcome. Have a wonderful weekend. I have no other pink cards, but is there anybody else in the audience that would like to speak? Representative Phillips. Yep.
Good morning to all of you and everyone watching. Thank you all sincerely for serving on this committee. I know that it's been a lot of time on a beautiful Friday, especially, and it's so important that you hear from the public about the pandemic. My name is Representative Emily Phillips from Fremont, New Hampshire. That's Rockingham District 7. I am a freshman rep. I was serving on a school board during the pandemic, and that was a trip. So, yeah, it kind of motivated me to run for office. I know that you have a charge, and you want to come up with the truth in what happened at the state and produce that for the public, and I appreciate that. But maybe, hopefully, we come up with legislation that's meaningful to improve the state's response should this happen again, right? So I am not a scientist. I am just a mother. I sell packaging, and I'm a state rep. So I don't have expertise on what was done correctly or incorrectly. I just have stories from the public and what I've learned in other hearings. I have some concerns about how the state, the DHHS agency, is still promoting the COVID vaccine for children. I don't believe there's evidence to support that. I would like this committee to maybe work on a directive so we stop that until there's evidence to support promoting COVID vaccines for children. I have heard in other testimony for various bills that at least 3, but maybe 5 children have died. And it's been linked to the vaccine or one of the vaccines that was used for COVID under emergency use authorization. One death is too many. We should not be promoting this and wasting our taxpayer funds promoting the COVID vaccines for children. I would like to see health and health benefits promoted by the state. I don't see any campaigns to promote, a healthy diet, physical exercise, vitamin D. Vitamin D is so important. I don't see any advertising for that. And I believe what the former Representative Betty Gay had said, that it's all linked to money and advertisements. DHHS is in the business of vaccines. They make money from this. That is not disputed. So we need to see the state promoting good health standards. Immune systems work. There are so many people who were told to stop exercising, to stay indoors. All these preposterous ideas that we were following, and it wasn't promoting good health. I would like to see the committee get DHHS on track to improve public health. I do believe that health is individual. I think everyone is unique, and we should allow providers to prescribe whatever they deem fit for their patient. I support everything that was just said. I would just like to see, we're using public funds. Let's promote public health and real health programs, right? Like, not just whatever's prescribed by the ivory tower. I was watching, since this is kind of like an open, we can just kind of testify. Okay. So I was following Children's Health Defense, and I listened to the testimony of a woman whose son ended up getting, he was in 7th grade, and he showed up for a physical, and he got a basic blood work done, or it was like a blood work analysis and a urinalysis, and then he got his vaccine of choice. And I think it was like a Tdap or something. So he got that, he got the vaccine on per the child's schedule right after that test. And so he ended up having a reaction. He got type 1 diabetes 30 days later. Now, the mother believes that that's correlated to that Tdap vaccine. So she happened to have gotten that analysis, her blood work done that day, so they could see a marker for the autoimmune reaction, and they were able to link it to that particular vaccine. I thought it was interesting because she had passed a bill in her home state. I don't have that information. I'll find it for you. But the child's name was Braden Bonavin, and I'm going to get that information. But basically, they were asking physicians to offer to their patients a baseline blood work or urine analysis at the time of vaccination. And I thought that was interesting because it's an option, like just to offer it to the parent before you get vaccinated. Do you want this? You have some sort of baseline, because as we know, there's no ability to prove a vaccine injury. I mean, really, we have a hard enough time getting people to report to VAERS. So this gives a parent or a patient the opportunity to just get like a health check, and it's only going to improve people's ability to catch early signs of, say, cancer or any kind of elevated issues in your blood work. As adults, we are offered baseline blood work at least annually, I think. Maybe it's every other year. But it's just part of our good wellness checks, right? We get like a baseline. They can catch high levels of, I'm not a scientist, but, whatever might be alarming in your blood work. So, and it's a relatively cheap laboratory test to run. So I like the idea of that, is to maybe have a legislation encouraging physicians to offer that to children, because children don't get blood work baselines usually, right? Or not offered it. So something like that. Another idea for legislation I thought is that maybe we encourage our physicians in the state to report vaccine injuries to the VAERS system. I just looked it up on CDC, and for COVID, they're not required to unless they're under emergency use authorization and it's a severe reaction. And they are only encouraged to for the licensed shots, like the BioNTech one and Comirnaty or whatever. They are encouraged to for any other reaction, but we know that they're underreported. That's been testified here before. So it's hard to, measure things when we don't have accurate data. So, I'm open to questions, but I'm just kind of rambling unprepared. So
Thank you, Representative. Quick question for you. I find it interesting that the mom had the blood test and the urine analysis. I think that's a great idea. So for legislation, because I'm not one for mandates, but do you think it should be mandated to physicians in New Hampshire that they must offer to the patient, the option? Not mandate that it be done, but mandate that they give the option. And that way it's up to the patient, their choice. But also with the mandate, I guess having a reason why they would be doing that, whether it be for a marker or just to have a baseline so that because to me, I never even thought about it until you just brought it up. So you could kind of chart your health and what's going on in your body or your children's body. So I think it could be an option. So what are your thoughts on that?
you said it better than I did. Like I said, I was trying to watch the Twitter feed where I learned about this to find out more information, and I will get that to you guys. But I'm all against mandates as well, but just to have a physician, and maybe this is compelled speech, so people might be freaking out, but just to have a doctor offer it to a parent. Now, if you have insurance or Medicaid or whatever, like these tests are relatively inexpensive, and a person may say no thank you, because a lot of people don't want to have their child get blood drawn. That's pretty traumatic, but the option is there, and it does allow a more accurate snapshot of your child's health. To have even a routine urine analysis, that's no big deal too, but having any kind of baseline just so you can say something changed, right? And this relates to the COVID vaccine or any vaccine, and maybe this is not out of the parameter of legislation you would consider, but I thought it was very interesting. As a backstory, I do also have type 1 diabetes, so I know the autoimmune component to it, so I thought it was interesting. I don't know exactly what caused mine, but who knows? And I certainly didn't have blood work before my routine childhood vaccines as well, so I like the idea of it, and offering people more options, informed consent to their health care is something I think that everyone should be on board with. So thank you for clarifying.
Representative Potenza, then Representative Belcher.
Thank you for coming and thank you for testifying. I know a little bit about your story, and I would love, today was kind of put aside for the public for us to be able, for everybody to be able to share kind of maybe personal experience, how the pandemic affected them or whatever, and giving examples of that. And you have a lot of that in regards with your time, like you said, on the school board, but more of that, you just, in the community, but with your own family. And so, of course, I've seen your testimony on other things with legislation. I know why you ran. It's kind of the same reason why I ran as a new rep. So, you've got an open forum to really speak about that here, and I think it's really valid about what you experienced, whether it be at school and stuff like that. And I'd love to hear it. So.
Now I think I know what you're saying. So during COVID, my school actually opened up full force in September of 2021. We all closed down in March, and my school is in Fremont, New Hampshire, Ellis School. It's a K through 8 school, and we decided on the school board that we're going to open, and we're not going to do this hybrid learning, every other day, half the body. We're not going to do remote. We're going to open, and we had an online option for parents who were not comfortable to have their children returned in person. So I think about 25% of our student body of 400 and change did an online option for that whole year, and then the other, 300 kids came to school in September of 2021. We had a policy for, as you recall, the governor didn't set a policy for any kind of masks or mandates. They said each school district make up your own policy. So we passed a policy requiring face coverings. Face coverings included masks, hospital grade or cloth, or a plastic face shield, whatever. So choose your path. And about 8 students in my population chose to wear plastic face shields. 2 of my children at the time, only had 2. They have individual education plans. They're special ed, and both for speech and language. So I chose the plastic face shields, and they were in 2nd grade in kindergarten, or 1st grade in kindergarten at the time. No problems were really had until kids started treating my oldest differently. They wouldn't want, one situation is my child was put with another child to work on a project, and that child said, I don't want to work with Colin because he doesn't wear a face mask. And so the teacher in the moment said, okay, Colin, I'm going to assign you to some other student. Is that okay? Instead of using that opportunity to say, you're both safe and you're going to work together and everyone here is fine and healthy and you're going to work together. There's nothing different about Colin. No. So it's just like when we do things like this, we kind of make like invisible disabilities very visible, because Colin couldn't wear a face mask because no one could understand him. My daughter was mute. She was a very late speaker. We had tons of ear infections and all sorts of stuff. So she started preschool during COVID. Went to kindergarten in 2021, and all of her peers were wearing masks. She was supposed to get speech and language therapy every day. During COVID, a lot of these special education services went out the window because we had special education providers just holding down the fort, right? We didn't do substitutes in our school because we were concerned about the virus coming in. So we had, every time a teacher had to be out because they had their own childcare issues or whatever, we had a special education teacher subbing in that room. So basically, let's be honest here, children took the brunt of COVID. Okay. So my children didn't get their special ed services, and no other children in this entire state got what they were entitled to during COVID. So my daughter was not speaking in kindergarten because she couldn't read lips. So that's how she was overcoming the fact that, so when everyone covered their face, she didn't understand what was going on. And even when people speak to me in math, sometimes I think that I'm a lip reader as well. So she would just be quiet. She would go along to get along, follow the path. I ended up holding her back in kindergarten because I wanted her to actually have that play-based year. But we're talking about squares in tape drawn on the floor, and the kindergartners would sit. They didn't have tables because they didn't want kids using communal spaces. So they had the kids sit in little squares in kindergarten. So I called it preschool prison because that's what it looked like. They drew up, they showed us all these squares these kids were going to sit Indian style on and learn, and there was going to be no interaction, no touching. It was, and I was sending her there so she could get her services. After that year, they said, she's still not talking. I said, she doesn't know anyone's names. So she's now a year past kindergarten, but she's still in kindergarten. And special ed was like, yeah, she doesn't speak at school. And I said, she's scared. I said, she goes to summer camp and she talks. And by the way, summer camp didn't require anyone to wear masks. So it's like, we're all just playing our own game here. And, The school basically hinted that she had some sort of psychological situation going on. So they suspected, now they do not diagnose in public school, okay, but they were hinting around that she had selective mutism. Selective mutism is an anxiety-based disorder where you just get all overwhelmed and you don't speak. And the only solution, the only approved treatment for selective mutism is anxiety medication for my 6-year-old. And if we don't treat it, then she's going to clam up, and then eventually she'll, self-medicate, with, who knows, cutting or, drugs or whatever. That's what they say. They say if she doesn't get overcome this anxiety by 8, she's doomed. So I said, okay, I'm going to homeschool. So I homeschooled. This is in 2022, and I ended up running for office. It was just a whole hot mess. But my daughter is fine. Like, she's good. She's talking. She's now back in a charter school, and she's having a great time. And it was really just her peers being covered that she couldn't form those connections. So my daughter is probably one of thousands, if not millions of children who just panicked. And like, could I have chosen to medicate her? Could I have chosen to start therapy and do all these other things? Yes, but I just said, we need a mental health year. So we took them out and we did some co-ops for a year. And I ended up retaining my son, who's now in 4th grade, should be in 5th grade, and put them in a public charter school this year. And they're doing great. And everything's back to normal, right? So I think that's why people are like, why are we even doing this committee? It's like, everything's fine. The chains are looser, but they're still chains, like we need to make sure that this doesn't happen again, because we sacrificed an entire generation for this. And everyone's trying to act like, let's move on. Okay, all the kids are behind. It's not okay. And we're moving the milestones, and we're saying it's all right. We didn't know, or everyone was doing their best. Well, like, this is what this is for right now, right here, to make sure that we don't do this again. My daughter, like I said, was very, very quiet, and she was at summer camp, and I took her for a wellness visit. This is during 2021. And I show up at the wellness visit, and we were taking off her shoes, and her ankle's black. And I'm like, what happened to your ankle? She's like, oh, I heard it on the trampoline. And I was like, did you tell anyone? And she's like, no, because she's quiet and she's scared because everyone's wearing masks around her. Like, they didn't require her to wear anything, but like, there were still counselors and everything. And she just was shy and scared. But it's like, she had like cracked her ankle. Like, it basically was a sprain. But like, I was horrified because I'm like at the doctor's. I'm like, I didn't know she had hurt her ankle. It was like black, and like, okay, she's fine. We had an x-ray and she was fine. But these kids are like scared to challenge adults or tell people things, especially with the masks on. Masks are scary to little kids. Imagine the kids down in daycare. Like, we've seen the videos of people putting masks on 2-year-old kids. Like, have anyone ever had a 2-year-old? Like, it's just absurd. I now have an almost 3-year-old, but I just think it's so funny that they think intellectually that when you turn 2, you're able to wear a face mask. Like, who decided that? And then there's daycares who won't let you come in if your kid can't wear a mask all day. It's like, I can't wear a mask all day. So I don't know what else is relevant to my story, but I think that we need to think about all the people who are silent and who don't have a voice. Like, we're all here and we all have a backbone, and we're here and we're speaking for what we believe is right. But like, there are so many people who are scared to come out and challenge things and say, that's not fair. That wasn't right. And like, or they're gone and they're dead. I mean, whether it be hospital protocols or a vaccine injury, or they took their own life, like, how much mental illness has come from this, the shutting down? People lost their businesses. They lost their careers. They lost family members suddenly and unexpectedly. I am 40. I turned 40 this year. Have never, ever seen so many people in their 30s and 40s dying in their sleep. I am not a scientist. I can't say definitively what it is, but something is up. And I'm not saying this is a state issue. I would just like to see DHHS support public health if that's truly what they're in it for. There are so many ways to improve people's immune response to everything, and the health overall, that is just not being done. We don't spend money on actual health campaigns here. And if I'm giving my tax money, I'd like to see people talk about exercise, talk about vaccine, like how to report what you suspect to be a vaccine, injury. Because if it's true, we need to have the data, right? I don't know. I think a lot of people have changed course. I vaccinated my first 2 children. I'm in a I was in a vaccine study up until 3 years ago. I have all these scars on my back from a vaccine that I had taken 5 different shots to try to help with type 1 diabetes. I am pro science. I've donated myself and my time to so many different studies for medical devices and vaccines. Like I said, I'm type 1 diabetic. I'm hesitant. Like, I don't trust what's being said on the news because of who's paying for the advertisement. Like, why would they ever post anything or do a evening news critical of a pharmaceutical product when their number one donor is Big Pharma? So I'm saying it out loud. A lot of people won't say it, but I mean it. Like, there are people like me who have changed course and are hesitant of what has been tried and true recommended healthcare. And it's like, I'm not the only one. So how do we make people more confident in the state of New Hampshire? Because I think, like, we can't change the impact of people's opinions on the CDC or the FDA. I don't think we can influence that. But how do we make people trust the New Hampshire government and how they will respond in the next situation?
Representative, if you don't mind, do you think that if we had people from the scientific community discussing in a forum type, instead of just one person basically reiterating what was coming down from the CDC or the FDA, that New Hampshire would take responsibility for what it is putting out, and doing our own research here to protect our citizens? Do you think that might be something that we should look into?
Yes, I think I wasn't a sitting state rep during the pandemic. Most of you were. So did you get emails from your constituents like, save us, help my business, stop this, I'm going to lose my job, help me? And did you feel powerless? Like, I think we tried to limit executive powers this term. I think people want more representation instead of it being regurgitated from whoever is calling the shots at the federal level. And then we're being told that it's local control. But is it though? Because, like, as a school board member, we wanted directives from the governor. We wanted the governor to tell us how to set our policies, and because we were getting the hate mail at the local level, right? And so, like I said, I was fortunate that we had a lot more liberty at my local school district, and we did not have any outbreaks. There was nothing terrible happened in my school system at all, besides, like I said, maybe some bullying or whatever. But we functioned very well, and our kids are better for it, and our school district is better for it. Now, there are other school districts that went either fully remote, or they did this hybrid thing where kids were coming Tuesday, Thursdays, Monday, Wednesdays, trying to divide, and we're just trying to panic and survive. Meanwhile, the teachers' kids weren't in school and they couldn't come to work, and it was just an absolute mess. So I think that having more decision makers, more qualified people, and not just one person regurgitating the same story is what the people want. That's what this legislative body is all about.
Let me ask the question another way.
Sorry.
No, you answered perfectly, but I'm just going to pivot a little bit. If the government of New Hampshire is receiving funding from the federal government, are we not beholden to do what they say? And how would we overcome that?
All federal funding has strings attached. We got to read the fine print. How do we overcome that? We could just not take the money. We are a surplus state. If we are concerned with the strings, so I'm being told that some of the fine lines and all of the federal funding, that's not real, or they would never do that. But I read things literally for what they say. So I have concerns.
Well, I can tell you, and I'm going to go off topic a little bit, that we have a very obscure law on the books from 1986. How do I know this? Because this is what happened to my son, is that in order to accept federal funds, we put a law on the books that says that if you are in a 6-wheel dump truck, you are required to wear a seat belt. and my son got a ticket for that with farm plates on the truck. So, anyways, I believe Representative Belcher had a question.
Thank you, Madam Chair. And thank you for your testimony. I just wanted to ask if you were aware of the fact that roughly within the last week, Dr. Deborah Birx, who's really fundamental at the federal level in the pandemic, did an interview with Chris Cuomo in which she called for an investigation into vaccine injury, acknowledging that there are at least thousands of vaccine injured patients.
I wasn't aware of it, but I'm not surprised.
Representative Potenza.
So just going back to a couple of the things that you said, and following some of the legislation that you had put forward, what we could do as legislators, because, in a sense, we're here from our constituents, they're the boss, and we should be, the whole reason why I'm here is because I believe that we need to protect their rights. So what about in regards with, like, of course, it needs to come from our health agency, that it has to come there. But what could we do, whether it be with legislation, with informed consent? I think that's first and foremost more than anything else. In giving people that kind of, besides giving them informed consent and showing them what their, in a sense, their options are. Like, how do you formulate that, that we could get that coming, not just what we do through law, but making that a reality for New Hampshire families?
I did sponsor a bill that did not pass the House. It was HB 575 last year, and then it became another spinoff, SB 319, which was informed consent when it comes to the state purchasing, promoting, and distributing vaccines or pharmaceutical products that have not completed clinical human trials. Most people think that makes perfect sense. Now that would still allow private providers or hospitals to purchase and promote and sell whatever vaccine anybody wants, right? Unfortunately, neither bill passed. I believe it was interim studied in the Senate most recently. So we just have a lot of people. I don't know if the data is sufficient enough for some people, or if their heads in the sand, or who knows, but they're not seeing that this is actually testing unproven products on our population. And now the state is paying for it with taxpayer dollars. So, yeah, I'm big on informed consent. So I would like to see all sorts of legislation, make sure that the conversation between a provider and a patient is thorough and that they know what they're consenting to, because I think all too often it's minimal or it's not happening at all. And people don't really know that they are empowered to say no.
Representative Lekis.
Do you know how many which vaccines have actually had full clinical trials and approval and everything?
I believe the answer is, if you're referring to the childhood vaccine schedule, none. So after the rollout, that's when it's happening. So what's happening now is the clinical human trials for the COVID vaccine. So I mean, you maybe you know the answer to your own question, but I believe the answer, so even like the flu vaccine is new every year. So that was one of the obstacles or objections to my original bill, was that this would not allow us to promote and sell the flu vaccine because it changes. It slightly is altered every year based on what they predict will be the strain or dominant few strains. So I guess I just don't know the answer to that question, but I don't believe that many pharmaceutical products do not do clinical testing, real, true, blinded, double-blinded. It's a study usually funded by the manufacturer themselves, and it's very small. So again, I don't work for them, but I don't think a lot of stuff that comes to market is fully clinically human trialed, like that we wish it would be.
Just to piggyback off of what Representative Lekis just said, I never really considered the flu shot, as I always called it, a vaccine, because I thought vaccine was a little bit different it was. The flu comes back every year, so that it's a shot that you have to get every year, where a vaccine is to help stop the spread of disease, measles, mumps, polio, etc. Am I missing something?
I agree. I mean, even the COVID shot is not a vaccine, because we all know now that initially we were told it would stop, but it doesn't stop transmission, right? It's alleged to minimize severe illness and decrease hospitalization. That's the latest I've been told about it. Yeah, I agree with you.
Regarding the COVID shot or vaccine, however you want to, whatever terminology you want to use, do you think that when it was rolled out, it was labeled safe and effective? Do you think that was truth in labeling?
No. How could it be? Wasn't tested.
Does anyone else have any questions? Representative Potenza?
So I'm not sure when this was. It was several months ago when I'm not sure if there's some people on this committee, but in regards with there was a I know some people that are on HHS would know. Gary would probably, Representative Merchant would probably know. But in any case, there was a form or a notice that was on DHHS that they said wasn't there, but it was found and it's been subsequently saved. And you can't find it now, but that was still promoting, because it's kind of like what you said in your first of your testimony, the childhood experimental gene therapy, which is what I call it. Let's call it what it is in regards with those injections for children with COVID. And so that sheet, that promotion sheet, is now no longer on DHHS, but and they said they weren't promoting it, but they were. And so are you familiar with that whole thing that happened? It was several months ago, and it was a little bit of a
Yeah, so it was a graphic for the childhood vaccine schedule, which is normal and what is required for entry to childcare or daycare. But at the bottom of it, it was recommended the COVID-19 shot. So, like, what I'm saying is that we shouldn't be even recommending it. There's no science to recommend it. So it's not required as part of. So a low information person would go to that page and say, what does my kid need? They're 7. What do they need? Okay. Yep. COVID, everything. So it was listed within the graph of ages, like on in the annual flu and the annual COVID. Now the flu's not required either to go to school, but it's in there. So I'm just saying, when you print out that graphic or it's put on the wall at your local pediatrician, you're leading people to believe. Now, these are like little words that, legislators catch or whatever, but the average person are going to say, oh, this is recommended. I got to get this. So yeah, I don't believe it's there anymore. It was changed when it was pointed out, but now DHHS will testify that we will never mandate the COVID shot. But those are just words. So they're recommending it on sheets. That's what I guess by now, I think the majority of the room, the majority of the state understand that this virus was never really a threat to children, and that the myocarditis risk for especially young boys is enough to say, let's stop promoting it. You can choose it for your child. You can choose it for yourself. But why are we pushing it with state funds, with taxpayer dollars? It's just not there. Protect the people who might benefit from this if that population exists. It's not the children.
Do you believe that should be between the doctor and the patient?
Yes.
Thank you. Representative Potenza, follow up?
Yeah, I think what you just said, it just kind of hits the nail on the head for me. This was about a month and a half ago. I was at the gas station, and I'm sure we're all familiar with the gas stations that have, most of them do now. They're newer, and they have the, I don't know, it's kind of like a little screen, and it tries to sell you on something while you're filling your tank. Well, there was an ad specifically in regards with COVID injections from DHHS that was on the gas. What is going on? Why are we spending the money on that versus spending the money on education and health and all of that? And this is where I really believe where there is risk, there needs to be choice, and where there needs to be informed consent, and where DHHS, my gosh, how great would it be if at these, gas stations, they're promoting health and nutrition and supplements and all of that kind of stuff versus an injection. So
Yeah, I mean, what if they were promoting getting your child a basic blood work panel? I just I completely agree with what you just said. So I just we're just using taxpayer. So I said it before, and I'll say it again for people who need the clip. But DHHS is in the vaccine business, so that is why they are promoting it. They make money off of this. Okay, it might be federal funds, and it's all our taxpayer dollars. But you know what I'm saying? Like they are making money off of this, so they are going to promote it. And the end. So this is a product that they can continue to sell. So that is why it's on every corner at Walgreens, and it's, being promoted because they have to spend the money. Because guess what? If DHHS doesn't spend their money, their budget might be affected next year, right? If they stop spending money, then we're gonna say, oh, you used less than we were budgeted. Let's trim that down, maybe. The people in finance in the budget year next year might say, oh, we don't need all this money. So they're gonna continue to spend this when a lot of people are not buying what they're selling anymore. Whether they bought it initially, people are fatigued or they've changed their mind, but these products are not being consumed like they were 2 years ago. So they're just going to continue to promote it because they're just trying to sell the product.
Representative Weary.
Yes, thank you, Madam Chair, and thank you, Representative Phillips, for taking my question. I'd like to touch upon a tangential aspect to this that I think the discussion about diabetes has reminded me that fatalities associated with COVID were often patients who had a multitude of comorbidities. Mm-hmm. So there was, in some cases, diabetes, obesity, other illnesses, and it was really an extremely high percentage of those patients or those people who died from COVID because they had a number of other mitigating health conditions, and it was surprising because I remember seeing the statistics at one point. It was a multiplicity of conditions, not a singular condition. So diabetes wasn't a death sentence with COVID. Mm-hmm. It was merely, something to be precautious about. But if you had a multitude of these on top of each other, of these comorbidities, then you really had a much greater chance of not only catching COVID, but probably because of a weakened immune system, of really then succumbing to COVID. And what I think this ties into the discussion that you've introduced to us about the advertising, because I think if you're telling people that this is a deadly disease, but not revealing that it's deadly to people who have low immunity and comorbidities, then you're creating this illusion that this disease is deadly to all. And I think we really didn't see that. We certainly don't see that for children. So I'm wondering, I'd like your opinion on what aspect does not having enough information about and the fear aspect of that would incentivize as you termed it, the low informed person who is not really doing their own research. What would incentivize them? How big a factor could this fear in not having all this information incentivize them to take basically vaccines that they don't need?
That was a lot. So I agree with you that the way it's marketed is that this is a dangerous virus for all, and also it markets the shot that this will be beneficial to all and everyone should get it. And a lot of the times it's do it to help out others. That was the messaging early on, is that I'm doing it for my community. I'm going to take this shot to help slow the spread, or but now we know that you don't have a less of a chance of catching it. In fact, you may just be lower symptoms, and you may be going out and about when you are sick, and your viral load is lower, right? Or your symptoms are masked, and then you're passing it on to a newborn baby or your elderly parent in the nursing home. So I guess, yeah, I just feel like if there's going to be a campaign of taxpayer money, now I can't stop Pfizer and Moderna from being who they are and marketing their product, but we can stop spending taxpayer money with incorrect or incomplete information about the product they're trying to push. I just think we're wasting a lot of money on an entire demographic of school children where this does not benefit them. And in fact, there is an increased risk of myocarditis. That is, no one can refute that. So why were we risking our young boys for a product that has very, very well documented a significant risk? I mean, people may say it's rare, but why risk it when the benefit does not outweigh the risk? Because there is literally no benefit to the vaccine for children. I'm not sure if I answered your question, but I just wish that the messaging from DHHS was complete, that we do not recommend this for people under 60, or this is not necessary. Talk to your provider about your individual risk. I'd be fine with that message, but because it's on every gas station pedestal, or it's on every side of a bus, it's just we're wasting money. And we could use that money to actually improve health outcomes, right? Like, that's what we want to do. We want everyone to be stronger and healthier and use less services because they're living a healthier life. And the comorbidities, excuse me, early on, when this came out, I thought for sure I was a goner. I have type 1 diabetes. I'm like, well, I'm going to die. So I was wearing a mask, for 6 weeks. I was like, guys, we're going to live, and we're going to put our groceries in the sunshine, and, we're going to do what Fauci tells us to do. And then I realized this doesn't make any sense, and so that was my decision to do that. And I feel like having a healthy body is our best defense against everything. And I would argue that those at the time of COVID who passed away with COVID would have died from the flu the year prior. Okay, or whatever virus. So when you have a weakened immune system and you have all these complications, any virus can make you ill. This is what we used to do back in the day. We would say, oh, when you're sick, don't go around, the elderly or newborn babies. You don't want to give your virus that doesn't really, impact you to them because they're weaker. So I agree that people with all of these conditions had a less of a chance of survival, poorer outcomes, needed help because for some people it really whacked them down. I don't know a single person, and I've never heard of anyone who died at home with COVID. Nobody was found dead at home with COVID. So I don't know if it was the hospital protocols and the whole system that did people in at the end. I'm not sure, but it just, if we had given everyone, like you said, prophylactics and a little vitamin D and zinc and things like that, like India did, maybe we would have all protected ourselves a little bit more from needing those services. We were told to stay home to the bitter end and then go in when you couldn't breathe anymore. What else can they do for you? It's just, but again, I guess we could all complain for hours, and we've all done it at our dinner tables about what has happened and how we want to make sure it doesn't happen again. But what is the meaningful point of this committee? What can you guys do so you don't feel like you've wasted your Fridays here all spring, right? What can come of this? I would like to see DHHS use our money more conservatively. There's no science to back up the money they're spending on promoting it for children. And school's coming. So all these kids are going back for physicals, and they're going to start school or camp. I just took my children for a physical exam. They're getting these visits, and they're going to get, okay, well, do you want another COVID shot? And I think it's annual for kids. I don't know exactly what they recommend now for kids, for people who are doing it, but it's just can we just pause until more information comes out? Plus, there's more variants, right? And we're all talking about what covers what variant.
Quick question for you. A couple times you mentioned increased risk of myocarditis for boys. Do you have access to that information that you could send the committee?
I mean, not any more than anyone else does, but I assume it's been testified here before. We had so many more knowledgeable people a couple weeks back, but to me, that's basic knowledge. I don't know. So I'll find something to send you, but yeah, okay.
Okay, Representative Potenza, please.
Thank you.
All right, thank you very much. Any other questions for Representative Phillips? Seeing none, thank you very much for being here.
Thank
Appreciate
you all
it.
again.
Does the committee need to take like a 10-minute break, or do we want to continue on? We got 2 more. Pardon? Okay, 10 minutes? Okay, quick 10-minute, we'll come back we'll recess until 12:20. Thank you. 12:20, I'd just like to call us back in. And I have a pink card here for Diane LaChance. Would you like to come up? Please state your name and where you're from. And
I'm Diane LaChance. I'm from Kentuquook, a village in Hopkinton, New Hampshire, in case you're not familiar with the Kentuquook. I fully expected to come to a room full of people like myself. I'm here to represent myself as a citizen. I'm not a representative or past representative. I only found out about this meeting a few days ago, and I shared it far and wide because I knew there were a lot of people out there who have a lot to say and who were hurt badly by the pandemic. So again, I fully expected the room to be full and to arrive. I had an appointment I had to go to at 10, and I figured I'd arrive with plenty of time to make my notes to speak. And, you know, you might think maybe you should have written your notes a few days ago, but I couldn't. I opened up the governor's executive orders, and the anger in me rose so high. I wasn't sure I was coming because I said, can I afford to be this angry again? And I said, you know, if I decide to do this, I'm going to open up, you know, all of this again. And I really think you need to consider that the reason people aren't here are numerous. One is that exactly what I said, because what I experienced in the pandemic, I think I have a right to be here and tell you, but it's so minor compared to what happened to other people. And what happened to me never should have happened to anybody. So I know one of the things that gave me the courage to still come, because I saw nobody was here, was she's not in the room now. A representative was speaking at length, and I was listening in the car. And she said, I'm not prepared. I didn't know about the meeting. And I said, well, that's me. And then when I realized she was a past legislator, I thought, well, if she can get up and just sort of find a way to be as coherent as possible, although being unprepared, then maybe that'll give me the courage to do it. So I have a lot of random things to give. Also, the other thing I think that's hard is when you're told you have 3 minutes. And I thought, well, I don't think they're going to cut me off at 3 minutes. Anyway, so my first, I know the legislator that you spoke about, she talked about forums. And I guess if I don't know that I have any suggestions about laws. Let me tell you, I just have no idea how law works anymore. And my son's a lawyer. My grandfather was a lawyer. I don't know how it works anymore. So I applaud all of you for staying in the fight. And I listen to everybody speak, and they have really good ideas. And it's because you had the tenacity to sit and listen to an awful lot that most of us, you know, we just can't do it. So I appreciate very much what you're doing and what you continue to do, because there has to be an answer in all of this. But she talked about forums, and I don't know if that's like to prevent the next fiasco that we've just experienced, or if it's to continue this discussion. I think another reason people aren't coming is that after what they feel the government has done to them, it's a little hard to walk into this building, a little hard to walk into the State House. It's really, I've testified, I was a homeschooler for many years, and I testified many times. It took a lot of courage. So I have a little bit of experience that probably helped me to get here. There are an awful lot of parents with young children that they didn't even know they had to fight for their rights. I didn't know I had to fight as a homeschooler every single year for the right to not take any money and be left alone. That was a big eye opener. And now I see all these young parents, and I kind of get upset that they're not speaking up. And I'm like, they don't know. They don't know, and they don't know how. And it's all very intimidating. So if I had a suggestion, it would be, I don't know. I mean, when my son was homeschooled, it was Supreme Court on the road. They went places, they went into communities, and it made it a little more welcoming. They didn't have to go to this, Supreme Court or the Superior Court, and they they, it was in the school, I wonder how many people might come out if you were at a school in a community and said, we want to hear from you as a community, and they might feel safer in their school. They might actually feel a little bit like, I can remember what happened in these walls, and I don't ever want it to happen to another child again. So I have that to offer. But our story, my story, is that I worked for a pharmaceutical company for 18 years, as did my husband, and very well acquainted with the demeanor and the behavior and the expectations of the FDA when it comes to the safety of drugs, the manufacture of drugs. I worked in a facilities capacity, as did my husband. And when we would get a notice that the FDA had arrived, because there's never prior notice, they're here. You knew you had to be ready to answer questions, and you need to have your ducks in a row. And it was important. It was important. You were making products that were going into people's bodies, and the people I worked with took it seriously. We took it seriously. One of the things I would have done if I could have prepared was to actually get some clips for you from, or of the FDA approval meetings for the vaccine. I had the audacity to think I was, smart enough to go to the meeting when they were making the approvals, the Zoom meetings. And I asked other people, are you going? And they're like, no, how would I know? And maybe they don't. I didn't know most of what was being said at the meetings. But I did note that the demeanor and the behavior of the FDA was not what I recalled. I don't want to say a lot because I would prefer to show you clips and ask you, is this how you would expect an official from the FDA to respond to some of what was said in those meetings? I've learned over the years it's very hard to get people to watch. I'm not going to get anybody to watch this when you put it out there for us to view. It's like very hard to get people to sit and watch these hearings and these meetings. But they're very informative. And I had concerns. I have my own health issues. I pay close attention to my health. And we decided early on that the evidence wasn't there to feel comfortable taking the vaccine. A little interesting note is I did speak with my doctor, and my husband was with me, and my PCP, and he said that I had a 98% chance of surviving COVID if I caught it. I still thought I should take the vaccine, which surprised me. And I thought, well, okay, but he didn't push it. And I have to say, I applauded him, and I continued to seek his advice on various things. Unrelated to COVID, but during COVID, I was seeking some care from a naturopathic doctor, and I contacted someone that was advised, someone said she was really good, and I had a talk on the phone before I went, and I advised her that I hadn't taken the vaccine. I wasn't interested. What was her position on it? She was right there with me. There's no reason, blah, blah, it's fine. You're welcome, you come in. And I saw her twice, and I can't recall if it was the first or the second visit, but they were only a month apart, the visits, appointments. And they took a pretty comprehensive history, and we talked about everything, and we talked in a private room, and it was all well and good. And then, interestingly, in the hall on the way to pay my bill, she said, "You need to get the COVID vaccine. You're at high risk. You're very likely to be hospitalized if you get COVID." And I was like so taken aback at the unprofessionalness, telling me while we're walking down the hall, and we'd already had a long conversation. And when her opinion of that changed, I'm like, why wasn't that talked about maybe first when we got to the appointment? We had this conversation before I took you on as a patient. That really rattled me. That's what caused me to call my PCP and say, well, maybe it's time to talk to my doctor about what are my risks. So it's really interesting, I think, and I'm just getting it out there for what it's worth. I didn't get the vaccine. I did catch COVID. I was sick for several days. I probably have some things that maybe is still residual, some ringing in my ears, whatever, but I fared pretty well. I don't think any of us, I don't think I know, I'll speak for myself. I don't really know whether catching COVID, for me personally was better. If anything could have been better if I took the vaccine. I don't know anything, basically. We don't. We weren't told anything. Everything was suppressed. The ability to have conversations with everyone, the people who agreed with where I was going down the road and the people who disagreed. I didn't have that opportunity because most of the people who disagreed just treated me poorly and said, we can't talk. So you have that.
May I ask a question?
Sure.
So, based on what you just said, do you think it basically created like two classes of citizens?
I guess I would want to research the word class a little bit. Language is important. I certainly created two sides. We carried on. We followed what we were asked to do by our government. We didn't agree with all of it. I do agree with people who say that the governor took too many liberties with his powers. I may be right, I may be wrong on that, but I will give you the one thing that stood out for me. And I felt probably bothered a lot of people who won't speak up. And that is when the governor, I don't believe it was legally, it was probably more part of his casual comments that he made along with his legal documents that were posted. But my recollection, and I heard it more than once, was that it's okay to go out and drive if you are going to work, grocery shopping, medical appointments, and emergency. Other than that, the only people who really should be on the roads, because you are a risk to our service providers, should you be in an accident or need care, you put them at risk for catching COVID, you just put them at risk because we have to deal with it. And the only other people who could go are people who were going to go and hike a mountain or exercise. Well, I'm home with a stress fracture in my foot. So I can't go hike. I can't go walk. I'm cooped up in my house. I've already been cooped up. I need to get out of this house and go for a ride. But the governor just told me that I've threatened, people's lives who I care about. I care about my emergency responders. I'm also an intelligent person. I could say, this makes no sense. This is discriminatory. If you're a healthy person and you can hike a mountain or walk on the beach, you can go and drive around. But if you can't, stay home, chin up. How many elderly people do we know who can no longer move? I see them all the time. I'm right up in that ballpark now. Go to the beach, open the window in the car. You don't get out and walk in the sand because, then you'll need some emergency services. And you just drive out into the country and put some fresh air in the window, in the car, and you go home. I started to feel like this is what it must be like to live in a country where, you have to carry papers and you have to justify every move, because we'd go out and we'd literally say, so we're going to hike Mount whatever, well, Monadnock, right? But when we get there, we're going to change our mind. To keep it right in our head. We says this is sick. When you have to come up with scenarios to feel okay about going out and taking care of your own mental health. That's a pretty sad state of affairs. And our governor should really rethink what he said on that.
Representative Belcher?
Thank you, Madam Chair, and thank you so much for coming out and testifying today for us. And I'm particularly glad to have you here, given your background and dealings with the FDA, because I'd like to ask you to respond to what I have seen just recently, which is some new information that has come out. Now, as I'm sure we're all aware, more and more information is always coming out about things that happen that we may not have known about through various Freedom of Information Act requests and the like. Recently, a Freedom of Information Act, and this is, I think, just within the last week, at the FDA, received some internal emails between some fairly high-ranking officials at the FDA regarding the COVID-19 vaccines, and citing specifically the deaths of two young people, two minors, after the vaccine, who were found to have myocarditis, and they unfortunately died. Now the FDA officials were extraordinarily concerned. They were extraordinarily concerned that if the public found out about this, they would reduce their uptake of the vaccine. Can you respond as to whether or not that would be the primary concern you would think of upon learning something like that two young people had just died?
It's a little disappointing, to say the least, that that would be the concern. You know, 18 years I watched products come down the pipeline, and they made it or they didn't make it. It was a lot of money. And I'd like to think, and I do believe the people I worked with had high integrity, and it's very easy to, you know, there's always people who want to just kind of skirt around the important issues. And I hope we caught them all. I know people who lost their jobs because, you know, honest people said, no, we don't do that. We're testing these drugs, and this is how it is. You don't do anything in a lab by yourself. Everything is witnessed. Don't ask me to witness something I didn't witness. I mean, I saw people lose their jobs, and I was so happy that they did because of the integrity. You know, I don't have the facts. I can only tell you what my experience was, and that's why I'm here. I'm here as a average citizen, maybe with a little more exposure to these things. Do I know everything? No, but I think it's important to listen to people and then investigate that. Maybe there is data out there, but I think we all know drugs have been pulled off the market for a lot less. And drugs don't make it to the market for these reasons.
Representative Lekas.
Can you go into a little more detail as to the difference in demeanor that you experienced with the FDA that you were talking about? And do you actually have the clips someplace that you could send us or not?
I'd prefer not to, because I'd rather, it was my feelings when I looked at it, and I think it's more fair to everybody to watch it and see it. I would have to research it. That was the other thing. I would have to start researching. I mean, at one point when we were going through all this, I kept some notes about what I was learning and whatever. It became so difficult that, you know, to go back and find it, but I probably could find it and send that to you, and then you could watch it, and I could talk to you about, you know, after if you watch it, and then you could ask me, I could ask you to look at a certain minute marker and say, well, what about that? I mean, I believe, if I recall, you know, and then there's recall. What am I recalling? Is it just wasn't professional, and it was concerned. It definitely concerned me. I talked to people about it, but people are afraid. They go, what do I do with that?
Thank you.
So for us, my husband and I decided that we weren't comfortable with the vaccine, and we didn't get it. And my husband lost his job over it a year and a half before retirement, before his plans to retire. I really don't care to give out personal information, but it's a lot of money. You take anybody, you can just probably find a number of people lost their job. What's the salary ranges? What are the benefit ranges? Take that, multiply it by how long it took them to find another job. At my husband's age, was he going to find another job? There weren't a whole lot of jobs in that. And his job required that you show up at work. On top of what we lost, we had to pay for medical insurance for a year and a half. And now with the economy and what's happening, it's, you know, uncertain. You know, we're no different than anybody else, you know. everybody's uncertain as in this economy, so I don't cry too hard, but it's real. I mean, I just get tired of politicians just sort of pushing it aside like it's minor. It's not minor. That was a lot of money in our plans. In 2024, there's no such thing as planning, I don't think. So, I have to sort of let that one go and be grateful that we're doing what we are doing.
Representative Potenza.
So in the last 3 years plus now, we could talk for hours about the stories that I have for people that either one, decided that they weren't going to get the injection. They tried, they might have done a medical exemption or a religious exemption. Then they lost their job. And then there's a piece that decided that, they were going to, even though they were in a sense bullied and shamed and all of that, and decided that they were because they had to provide for their family and all of those things. One of them that was severely vaccine injured, and now he can't provide for his family. And then the third piece is they just decided to get out of whatever they were doing altogether and go do something different. And but I don't, that's the whole thing. It should be a choice. A lot of people like to use the, my body, my choice, and I believe that 100%. So have you ever thought of going back to, because there's that first category that I told you that were either, denied an exemption, denied their right, whether they're going to take something experimental or not. Bodily autonomy to me is more than that. That means everything. To go back to be restored fully. I can give you a lot of examples of lawsuits that have been settled, ones that are currently in place in Massachusetts, in New York, and all of that, where, for example, doctors and nurses they were offered their jobs back, they were offered back pay, all of that kind of stuff. So I was just wondering if you've looked down that pathway or not. Some people were so abused and took it, and it's debilitating. So having to fight or having to think about the fight and a lawyer and all of those things is so overwhelming that people don't. So I was just kind of wondering. Oop.
I've raised that question, and to people who understand somewhat the law of New Hampshire, and the response I get is, and you didn't mention that anybody in New Hampshire who has actually won a case, and am I wrong, but is the law in New Hampshire, employees are at will, and my husband would be reminded that every single year, would get a letter with, here's your pay for the next year, and reminding you are an employee at will. And I don't feel that, with that in place, that we have a legal standing, legal ability to go down that road. And, it can take a lot of years off your life to deal with these things. And I guess we don't have any confidence that in the state of New Hampshire, the way the law is written, that we even should bother to start.
Follow up.
I hear what you're saying, but that, to me, it's a constitutional issue. So I'm not just talking about the New Hampshire Constitution, which has so many of our protected rights, but our U.S. Constitution. So a lot of these cases are based upon that, and it doesn't matter what specifically has happened, not in New Hampshire or not. So I'd love to see if we can try to provide you some resources for that, because I think that type of justice is, especially for folks that had decades of work and retirements and all of that. It's a unimaginable type of level of kind of suffering for a family. So
yeah, I would welcome more resources about it. I wasn't the one who lost my job, so it's not a decision I would make, but I mean, I might make the decision. It's not mine to make at this time. So I did want to talk a little bit about that in that, and I don't know legally what the legislature can do, but I believe the mandates were discriminatory. I don't believe anybody in the state employment was required. I know people who have contracts with the federal government who were threatened with the possibility that because they had a contract with the federal government, they would have to, but federal employees weren't mandated either. And I find it really interesting that some of the family members of mine who are in the medical field were really disappointed in me because they said that if everybody had gotten the vaccine, we would have licked this right from the start. Well, it was a no-go from the beginning if everybody wasn't required to take it, and they were going to give religious exemptions. And I found it comical that these same people wouldn't be in a room with me because I wasn't vaccinated, but they'd be in a room with somebody who had a religious exemption from the vaccine. What's the difference? To me, that just added in my loss of trust in so many things, because to me, that was just incredibly hard. And these are college educated people who felt this way. To me, I said earlier, I don't know if we have different classes of people, but we have different sides. And it became more of a political statement than a statement on anybody's risk to their life or their health. So,
Do you think the conversation ended up really being about what to do as opposed to being about your health?
I'm not sure what you mean.
So we were told to take the vaccine, to mask up, to social distance, but we were never really talked to about how to take care of your health. And that could be your physical health, your mental health, and other things that we could do to build up our immune systems. Do you think that was lacking?
It was lacking in certain areas. I immediately sought that out. And I do have relatives. I have some relatives who, in the medical field, who wouldn't have anything to do with me, and others who didn't like what they saw. And they advised me. They didn't agree with everything that was happening. They were caught up in it. And they early on told me to take vitamin D, told me ways to take care of myself. And I started looking for those resources. Unfortunately, they weren't from my government. Should I expect them to be from the government? I don't know. I mean, we all have to take care of ourselves, and I sought it out, and I believe it probably helped me tremendously. I mean, if there was a silver lining in all of this, is that I have taken large strides for my health and learned a lot about my personal health. I just wanted to share that we lost a lot of friends, people we thought were friends, because we didn't take the shot, and family members, big divides. I also experienced, I don't know what to call it. Maybe it's discrimination, but it felt much deeper than that. At an eye appointment, the technician knew that I had not had the shot. I was never shy about telling people I want people to make their own decisions, and I was wearing the mask as they required. But the behavior of the person was really off the charts. As I was putting my face into the eye machine, I was just trying to adjust the mask to put my face, and she literally flipped out several times, practically screaming at me not to take the mask off. And I'm like, I was nowhere near taking the mask off. And that happened 2 or 3 times in the appointment. And I don't know what to say about it. People had so much more injury to them, but it's like, I just couldn't believe this was happening. It was difficult. I left. I felt like I was slightly traumatized by it. I was shaken by the person's fear, and Anyway,
Do you think that the government helped instilled that sense of fear into the public?
I wouldn't say solely. I would say the media maybe even has a bigger part in it. Our government certainly, in my opinion, could have made other decisions. My father is gone. He was born in 1925, and he taught his children never panic, and I feel like our government panicked. My understanding, and again, I could have done some research, is that there was a plan in place for a pandemic, and it did not include many of the steps we took, closing schools, mandating shots, all of this. None of that was part of the plan. And it's really, if I had a chief complaint, it's why individual elected officials were not allowed to stop and think for themselves and to read those things and question them. I would have hoped that our governor would have done it. I think there's other governors in this country who did and made decisions, and I'm disappointed that that didn't happen in the live free or die state, to be honest. So,
Representative Belcher.
Thank you, Madam Chair, and thank you again. I just wanted to backtrack for a moment to the to help clarify the issue around around employment and what happened to your family and so many other people. New Hampshire is in law, it is a employment at will, or what you might call that sort of state. But the legal threshold for being able to seek recompense for these sorts of things that happened basically means that you can be fired for no reason in New Hampshire, but you cannot be legally fired for a discriminatory reason based on any sort of protected status. That provides an avenue for potential recourse. The the difficulty would then be, I'm not currently aware of any court precedent that would provide an easy avenue, meaning I'm not aware of any court decision at this point that found that being fired for refusing to take the vaccine, for instance, constituted discrimination, although I am aware that there are multiple lawsuits, both at least at the federal level, that are ongoing. We do expect court opinions on probably before too long. So just to clarify that whole issue a little bit, there is a potential avenue there for people who feel they were discriminated against. You can't just be fired discriminatorily in New Hampshire. But realistically, as of right now anyway, it would be an uphill battle.
thank you. I just want to see if I had anything else. I think that's all. I would just suggest what I said at the beginning is true, is whatever has silenced people throughout this pandemic is still silencing many. And I don't know the answer to get more people to come here and be willing to speak. I feel like, we lined up and everybody stepped back and I was the one standing forward. That's how I felt. Mikey, who eats, tries the live cereal, I really after speaking up about the opportunity to come here, I felt that I could not, not show up. And so I'm here. I hope it doesn't end with this inquiry, because obviously the showing is not maybe even what you hoped for.
I'd like to really thank you for being brave to come here and being a voice to help us understand how people in the public are hearing. I know we're going to hear from people on both sides. As you said, there was basically two sides. And I really appreciate you coming out.
And I'll just add a little emphasis on, my child was no longer in school, but, I homeschooled and I was familiar with a lot of school issues and I paid attention. And I think there's an awful lot of people out there that would like to speak and probably should be heard. I hope it's not 10 years before they feel safe to say anything.
Representative Potenza.
Yeah, I just wanted to speak to that in regards with, people and the amounts here. So it kind of still goes into, I always say we're in our own echo chamber, right? Being here in the legislature and stuff. And, but your normal average day person is not going, typing in New Hampshire General Court and going to look for hearings and stuff like that. It didn't get, I don't believe that this is going to be the only time where we're going to do this. So, and the next time needs to be a more of a true press release. Sometimes people don't pick it up. It wasn't picked up. So I think we could fill Reps Hall 20 times over. And I don't think that that's going to be a problem. I just think today was our kind of first time doing this. We were a little nervous too, and I don't believe that the message truly got out there. So there's a lot of, I just know personally, there's a lot of people that are willing to speak and be heard. There are a lot that are if they're in a field that are silenced and stuff like that. I get that, especially if they're in healthcare and things like that, and the fear of losing their jobs. But I think it will be bigger and better the next time, but it doesn't matter. This was enough today, and having you here is truly a gift, and I appreciate that. So I wasn't publicized enough, so I don't want you to think that, there's nobody that's going to speak up, because I think that there are a lot that will, and that will stand in solidarity with you. So
Thank
just
you.
know that.
Thank you.
Representative Lekus.
Yes, you had mentioned that you had gotten this out and contacted lots of people, et cetera. What was their response to you?
One person said if they could make it over from their job, they would come. They're considering coming. I said, oh, you probably could come after work. The places will be full, and don't have to miss out on work or make it difficult. I gave links to the streaming, because the streaming allowed you to be notified when the meeting started, which is always convenient. I can't tell you how many things I've missed because I just completely forgot what time it was. So I did give that to people so that they could at least listen in. I said, try to encourage them to listen in. Medical person said, good, you go take care of that. And I knew that was because they didn't feel they could speak.
Oh, thank you very much for coming.
Okay, thank you for all you're doing. I really appreciate it.
Thank you. Any other questions? Okay. I'd like to call Julie Smith.
Julie Smith from Nashua here. Thank you for the opportunity to vent. I was actually at home earlier, and I knew about this event, and I did my duty online and in social media and stuff promoting it. And unfortunately, I didn't get the zealous response that I was hoping for, but I felt like I did what I could do, and I was expecting a full reps hall. And I saw that 6 hours were allotted 10 to 4:30. And I know that elected officials always get to speak first. God bless them. I know they have other things to do, and I'm okay with that. So I was planning on coming later. And I was doing laundry this morning, and I saw that there was like no one in the background, and sounded the alarm to people, on, again, the usual social media groups. Hey, where is everybody? And I was told to hurry on down. So that's why I hurried here. But I want to say that back up. And again, like Betty Gay used the word patchwork earlier. I got a patchwork of things, and I'll try to be coherent. And my apologies in advance if I'm kind of all over the place. I think being in a chronological order, my personal COVID story, which is not sensational compared to various others by any stretch of the imagination. I was tuning in earlier, and a member had said this is public comment, and it kind of it's like it kind of stood up the hairs on my arms, because public comment in my city an event where dissidents and critics of the ruling class, they get insulted, they get silenced, they get chilled. I know this event, I mean, this hearing is about COVID, but now Rep. Belcher mentioned freedom of information, which is synonymous with right to know. And I got more to say on that in a moment, but I'd like to say that the institution of the whole COVID thing and right to know kind of go hand in hand, and they're very intertwined in Nashua. And I want to touch on that because we have a bunch of right to know crap, and I'll use the word crap going on. And how do I say this? With the hot mess that Nashua is, it's a dumpster fire. With right to know, and people that criticize the city, they get insulted. Time is limited at public comment. No matter what the public comment is about, they get cut off. And sometimes they get interrupted and cut into, and they can't say, I'd like to reclaim my time. And then afterwards, the Board of Aldermen, any member, has unlimited time, and they will insult that person for more than 3 minutes. And sometimes they'll double team and triple team insult that person. It's an unfortunate drama show. So I've never spoken to the Board of Aldermen, but I've run for alderman. In fact, I chose to be my alderman's opponent this last fall because he didn't have an opponent, and he had some pretty decent opponents. And part of my platform was never forget masks and property taxes. Now, I know property taxes isn't within the purview of this committee, but we had the worst property tax assault in my history in the city, which has been since 1990. And so that, my anger against my alderman had to do with those two things. And so one of my big signs that I placed in the city said, Alderman Dowd voted twice to mask Nashua. And I'll get into that on the timeline in a moment. But when I was out door knocking or campaigning, lit dropping, talking to people, most of the voters, most of the people I interfaced with, they really weren't interested in talking about COVID. I populated my business card with 5 bullet points because it was originally going to be a Vistaprint template, and I had opposes government overreaching COVID mandates. That was line number 1. Number 2 was opposes irresponsible spending, and then my last point, I needed to fill in the box, and I said Jersey barriers on Main Street, which comes out of COVID, by the way, and I'll get in on that later. But while I'm out talking to people out and about, when people looked at my business card and I greeted myself as my incumbent alderman's opponent, the first thing it was like a focal point. They're like, "Oh yeah, we don't want Jersey barriers on Main Street." It's like, you go with it. You meet the customer where they're at in sales. And when you're campaigning, you're selling yourself as a candidate. If they don't want to talk about COVID, and if they don't want to talk about the budget or right to know, if they want to talk about Jersey barriers, hey, I've made a connection with them. And that came out of COVID. And actually, Jersey barriers on Main Street in Nashua spawned out of City Hall's response to COVID. And it turned into a right to know with the Art Center. And I'm sure people are familiar with Lori Ortolano. And again, I'm going out a little, I'm not staying in the lane of COVID response at this point. But again, they go hand in hand. It spawned out of COVID. And I'm quite convinced as part of this Agenda 21, Agenda 2030, and who was it? Rahm Emanuel saying, never let a crisis go to waste, And the sad thing also is, they say the 4 boxes of freedom, you got your soapbox, we've been censored in Nashua. You got your jury box, we got Judge Temple, and, he's useless. And you got your ballot box. We've had 2 city elections, 2021 and 2023, the latter of which I ran in myself, and that one included the mayor. Unlike Manchester, we only have an opportunity to get rid of the mayor every 4 years. And I have to say that, as Nurse Therese would say all the time, Noah had to watch people drown while he was building his ark. Well, Nashua is drowning in Kool-Aid and apathy. And quite frankly, I'd like to move. But, again, for reasons outside the purview of this committee, I feel like I'm kind of stuck sheltering in place. And so to give the timeline, back in the very beginning, like, let's say around March of 2020, I used hand sanitizers. I kept 6 feet away. If someone wants 7 feet, that's fine. I'm all for, the traditional, don't share your germs and don't go near germs and all that. But then it's like, when things were being ramped up a notch, and you'd have Dr. Chan and Chib Burnett and the governor and the deaf man and, Adam Sexton and the 3 o'clock every day, the propaganda, people are being shut down right and left. And again, it's kind of like, okay, yeah, I'm in my own little world, selfishly speaking. I was one of the fortunate people. I worked in the Comcast warehouse, and so Comcast is a household name, and people were going online. And what does the Comcast warehouse provide? Modems. And you got the CEO, Brian Roberts, saying he's going to give $5 million, in his, like the Bible would say, announced with trumpets. Like, yeah, look at me, I'm giving $5 million to the underprivileged in Philadelphia, where Comcast headquarters is. So those kids can go to school online. And meanwhile, they're doing these wonky things in operations, and I have free speech to talk about it now because my severance is long over. So I'm not chilled at this point. But I have to say that these policies about like quarantining equipment. So a field service person would come back and like, okay, you have to put it in that box there, and you can't box it up and send it back. We were a hub and spoke warehouse, and I was in a spoke warehouse, but we couldn't send it back. It had to be quarantined as if it was a person or whatever. Like, okay, and I'd cheat. Like, seriously, the Virgo in me would be like, oh no, I don't want that one modem over there, and the truck is coming on Tuesdays and Thursdays, and I want it out the door, and then they would, bring in PPE, like, okay, fine. And then in May, early May, they came out with the mask policy at Comcast. But it had some interesting language, and I was playing my own lawyer. I'm like, oh, well, it said something like, well, if you can't be 6 feet away, well, 30,000 square, I did the math, like 1,500 square foot warehouse. I have my own workstation, my coworker does, and I have my own phone at the workstation, and so does she. So like, unless she said, hey, this is heavy, I need help lifting it, we can stay 6 feet apart. And the security camera, if anyone was actually at the other end watching, fine, so I never wore a mask. I never, ever. I spent the last 10 months of my employment, I'm proud to say, that I breathe fresh air. But the toll it took, it's like if I had a full bladder, I would think I was in an industrial park. I'm like, okay, I think I can wait until I go home. Or I would like pre-plan not having a second coffee. And again, this was very real to me. Not that, it's a first world problem. People that are getting fired for not rolling up their sleeve, or their kid has a school issue, that those things are obviously higher up the pecking order than whether or not I have seconds on coffee. But this is how mental it made me. I would walk to work because I live near work, and I would take note of like where the outhouses were on the construction sites, because I couldn't go home to use my own bathroom as a pedestrian and be back in time. But I was very obsessed with escape route. Like, I am not going out in the hall and leaving the warehouse because the coast might not be clear. I knew who the snitches were. And so, again, I felt like, as an essential person, while all my friends and their friends were being, sent home as non-essential, no, I never once thought that we were all in it together. Never once. I got hazard pay for 8 weeks. It was 25% raise. I was grateful. And I got, someone earlier said, papers, please. That the safety, the local safety officer in the company gave us our hall passes, and it was dated. So if I was walking on Amherst Street to or from work and someone said papers, please, not that it ever came to that, I had it folded up in my wallet. And so, meanwhile, so back to we're not all in this together. I'm getting hazard pay. I'm still getting a check. I'm still employed. And other people their businesses were being closed. And then there were other people on the other end, the white collar workers. Oh, they're getting a free, their payroll was never interrupted, never ever interrupted. They were sent home. They were in their bathrobe at their coffee table with their laptop, barking orders, making policy. And City Hall never ever furloughed or fired anyone. So that is correct. So these offices, the City Hall was like a fortress. It was by appointment only. And I had a neighbor in my neighborhood. I like her. And so I never wanted to create bad neighborly relations, so I bit my tongue. But she worked for a cafeteria company. It was contracted with Nashua Schools. And I'm like, okay, so now you lost your biggest customer. I'm like, no, we didn't lose our biggest customer. I'm like, well, everybody's at home online learning. You're making lunch, and like, oh, well, the bus, they didn't furlough any bus drivers. It's like they would make these lunches for kids that have welfare lunch, even though they're at home in their own kitchen. So like, because Nashua is so big into this federal school lunch program, and so no gym teachers were furloughed, no groundskeepers, security, cafeteria workers, whatever. And this neighbor of mine, again, I didn't want her to think I was, not happy that she was still employed, but, I'm a taxpayer, and, on goes the federal lunch, and on goes the, the library's having boxed lunches during the summertime. And, so that was like May. Then towards the end of May, they shoved local mask madness through. It was like on a Friday night before Memorial Day weekend. And that's when I learned what a home rule state was, because, there was pushback, and, I was pushing back in my mind, but I was not going to City Hall, and I was not talking to my alderman because I hate his guts. But on social media, I'm telling people, yeah, I'm driving out to Hudson or to Merrimack, or, I'm not spending any money in the city. And of course, I started getting insulted online, which is other people's free speech to insult me. Like, what do you got against keeping people healthy? And I said, that's not the point. That is not the point. It's government overreach. Well, you're killing my grandma. Blah, 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 blah. And it's kind of the same thing as what was mentioned by the person who spoke before me about hiking. Pre-COVID, I was active in the hiking community also, and people were shaming people who were making plans to go hiking up in the White Mountains. Like, okay, you get sent home from school or work, and you want to go out in fresh air. Oh, no, you might fall and hurt yourself, and they might not have to call a litter team out, and they're not 6 feet apart, and you're going to burden that little tiny hospital out in the White Mountains, and, and it's like the dominant, mouthy, pushy people that were talking that way. When someone, like a new person, would come online and ask a question about advice, I'd send them a private message. I'd say, hey, make your plans, do it. I support you, but I advise you not to advertise it. Don't say your intentions. Don't brag about it on Monday morning. Go ahead and do it. But this is the hostility. So the Mask Madness comes out, and then throughout the summer, so that was May. Now you're getting into like July, and now there's no imposed mask madness in the suburbs, But now Market Basket decides to come out with it. I'm like, oh, that's a real bummer. That's my favorite place to shop. It's the cheapest or whatever. And I can't go to Hudson anymore. It's all of Market Basket. I'll go to Shaw's. I don't like them. They're expensive, but okay. And then they did it too. So then Hannaford was the last holdout until September. So I was crossing the bridge out to Hudson and going up 102 for Hannaford. And they did it too. And I was thinking, wait a minute, okay, if people talk about private businesses can do what they want, and of course the opposition was saying, well, that's the private business, they can do what they want. I felt like it was a consortium. You have the three major competitions, the three Market Basket, Shaw's, and Hannaford together. They collectively, as a threesome, saw to it that nobody was going to get half and half for 99 cents a quart to put cream in their coffee. I'm just using a petty example, but they saw to it that if you have to go outside society, you have to pay general store price. If you want to perform commerce, whether it's a loaf of bread, container of milk, stick or butter, or whatever, and not wear a mask. And so I'm out in the upper hills of Amherst and going to these expensive places to buy little things. And I'm getting drive-through because they're not going to, it's like I'd never been told by a drive-through clerk that they wouldn't take my money if I didn't wear a mask. And I've ordered a lot of meal kits. It's not the diet that I wanted. And, as a member of Overweight America, it's not the diet that's right for me, but I was not going to participate in mask madness. And so that was in the summer. Then now you got primary coming up, and I was a candidate. My reps, or at least two of them, the ones that are still in office today, they joined with I don't know how many other reps on May 28th of 2020. They made a letter to the governor demanding that he muzzle the whole state. And I know one member of this committee who is married to a rep would know who my reps are because they're married to each other. I know you're not supposed to say names, but they demanded it. And I ran against them. And so I had primary coming up. And I had the utmost anxiety because I was a first-time candidate. And as a first-time candidate, I don't want to do anything to draw attention to myself, such as fighting with the election staff about, fighting about masks. And I had so much anxiety that I considered compromising my personal principles. I despise absentee voting. I despise it unless you are active duty military or bedridden. I just totally disapprove of absentee voting, but I was considering it. I was really considering it because I felt like I was being bullied, chilled, suppressed. And interestingly, county attorney was an office that had a primary, and one of the candidates, the one that didn't win the primary and later became a rep and later resigned this calendar year. He wrote a Granite Grok article called Voter Suppression, and it talked about if I catch that and I become county attorney, consider every election official on notice, and that's why I voted for him and I printed up the Granite Grok article and put it in my pocketbook in case I was given a hard time by the election staff at Charlotte School. I was ready. It was kind of like my papers. And interestingly, nothing happened at the primary. But then there was the election right behind it in November. And because it was a presidential election, that there was a line outside the school 5:15 in the morning. It's the earliest I've ever shown up to vote. And it was the longest line to date in my experience. And so I'm in line. I'm the only one breathing fresh air. And I'm like nursing that Dunkin' Donuts coffee as my, like people talk about on airplanes, like, okay, I'm having a coffee. I'm not, tell me to wear a mask. I'm sipping my coffee. And so 6:00, they let everyone in, and I'm just kind of like pretending I don't know that I'm the black sheep, And I hear, excuse me. I knew they were talking to me. I knew it was me, but I played stupid. Excuse me. And finally, this guy got right in my face. You're not wearing a mask. No, I'm not. And I'm like, oh, well, you're going to have, like, I looked at him. I'm going to have to go get the moderator. Now, this is where it became interesting. I don't want to identify myself as a candidate, not only to not draw attention to myself in a negative way, but I don't want to get accused of electioneering. Hi, I'm the rep candidate. So the moderator, who I did not know at that time, she comes, she approaches me and she's like, oh, are you willing to wear a mask? No, I'm not. And she's like, okay. And when she turned, I saw her name tag, and she had like some long unspellable last name. And from being a rep candidate and having the walk books, I door knocked her husband, and he let me put my sign in their yard. And long story short, there was a congressional candidate that was in the Air Force with this guy. So when I saw her name, I knew that my ballot would get put into the machine. But let me tell you, if it was any other ward in Nashua or any other place, how would my fellow voters voting the same way know that their ballot? There were stories from other communities where they would set up like a pop-up camping canopy and then like have this box or whatever, and people were sharing it on social media like, oh, this is this town and this is that town. It's kind of like it was like Jim Crow in the bubbler, or the water fountain or something, like and I was like, well, I know my ballot's getting counted, but that doesn't do anything for anyone else. And question? Okay.
Representative Potenza.
Yeah, I'm very familiar with there definitely was they created a two-class voter system when it came to folks in several towns, not necessarily where you were voting in that ward, but yeah, there was a lot of that I was very familiar with. One was in Bedford, for example. So did you hear specifically about any, voters that felt that their ballots weren't counted from not wanting to wear a mask?
Yes, I did. I do not have specific names and towns. Not that I kept a journal of it, but there was talk online and just through the grapevine that people were concerned that they were being suppressed, and how do I say this? It stands to reason that such people are voting for the same slate customized to their community down to their Senate and Rep district. So it is voter suppression. And Bedford, you did mention Bedford. Bedford was the where the person who educated me that Nashua is not a home rule state. But to that, so the election, that was election day, November, and we had a governor that said, oh, no, I'm not going to be like Charlie Baker. We don't need to, we don't need to mask the state. No. Okay. So Tom Lanzara is the only one that gets elected out of 27 rep seats in Nashua. And so trying to think of anyways, if you go up and down the ballot, the governor was one of the lucky few that got elected. And so he gets reelected. And then on November 19th, just a matter of a couple weeks after getting reelected, on the campaign trail saying that he won't, he does. He unleashes the mask madness for the whole state. And now that brings me to the whole topic of censorship and silencing people. Everybody knows Frank Staples. He's famous Frank. And he's not allowed to picket outside the governor's mansion on public property in a cul-de-sac. They're out there with pickets. They're peaceful picketing, peaceful. But the selectman brother of the governor silences. They force through without the due process of making a town ordinance called like picketing in residential area. And a journalist, Christopher Maidment, who I think he was working for New Hampshire Journal at the time. He had his credentials on him, and the police, they cited him and charged him also with that. So that's one example of the censorship. I had something else down here. Dr. Nass, who Betty Gay mentioned earlier when she was she forgot her name when she was talking a few hours ago when I was watching the live stream. Dr. Nass, look what happened to her, and just the mention of her. So 2 years ago, and it was April 6, 2022, when the Senate committee chair was stuck at a Florida airport, and the vice chair was chairing a series of hearings for bills, and then Rep Betty Gay was at the mic talking about Dr. Nass, and suddenly the vice chair cut in and silenced her. It's on YouTube. He silenced her. He said, well, we don't need to hear those names. And I can't unhear it. It was just question?
Yeah. Do you feel like there was censorship in New Hampshire?
Yes.
Representative Belcher?
Thank you, Madam Chair. I just wanted to, because an interesting idea kind of came into my mind regarding the issue of picketing and protesting the government actions during that time. You mentioned that people were cited and arrested and otherwise for picketing, protesting in front of the governor's home. But this was a weird time because most things were shut down. Do you remember at that time, was the government, the governor and other people, were they working?
No, the State House was closed. It was reopened the State House, and I remember Ann Kopp, rep-elect at the time, had an appointment to get sworn in because she missed organization day, and she had an appointment, and security wouldn't let her in.
So interestingly, I guess my question then is, it could be phrased, people were picketing and protesting the governor at his home, but could it not also be phrased, people were picketed and arrested for protesting the governor at his place of work?
Yes, thank you. That's a very important point, and I agree. You are right. And yes, I was going to add that there's been protests on the sidewalks in front of the homes of 49 other governors. So why is New Hampshire special? And I want to add to that. So this silencing, okay. Private sector silencing. Chris Ager, he's not an elected, is not a public elected official. But now we're into the spring of 2021, and my job ended. I took early retirement, which was for reason. Well, let's say the end of my employment with Comcast. It came to an end, and I left on good terms. So now I am newly unemployed or faux retired because I'm not 59 and a half. And so I have free time. And the Nashua GOP chair said, hey, we could use some help in the suburbs because the seat vacated by the unfortunate untimely death of Speaker Hinch is going to result in a special election in Merrimack. And so I'm outside of the church, one of 3 polling sites in Merrimack, and I'm there. I'm there with Steve Negron's wife, Rep. Maureen Mooney, and I'm being introduced to all these bigwigs because it's a special election. So Stepanik and Chris Ager, who I've never met before, but I saw Chris on the news being harassed in D.C. by some hecklers. So I knew who he was visually.
Could you tell us who he is exactly? I mean,
Oh, okay.
why is
So
he a
so
bigwig?
Chris Ager is the GOP chair of New Hampshire. Is that his correct title? And it was okay. So that was his title in April of 2021 at the time of the Merrimack special election for the seat that now is occupied by Bill Boyd. So I get introduced. Maureen Mooney introduced me to Chris Ager, and there was a discussion about how our governor would veto a standalone bill against, I think it was critical race theory, that in that he, because he told the press that it's against free speech for the teachers. And I said to Chris Ager, well, what about the free speech of Frank Staples and the picketers outside the governor's mansion on public property? And he looked at me. It was like the dirtiest stink eye I've ever received. Like, how dare you? That's not what polite society does. Now, again, he is not a public servant, but he made it very clear that that was unacceptable to think that way. A Republican, the highest ranking member of the Republican Party is telling me, how dare you support picketing outside the governor's mansion. So that I wanted to note on that this silencing and censorship, it was ubiquitous. So that was April of 2021. And then a little while later, it was April 16th, actually. So after the Merrimack election, the mask tyranny expired, and I don't know what made our governor decide not to renew it. But I was elated, and I was not alone in thinking, don't anyone thank him. You do not thank your tyrant for giving you your freedom back. That's Stockholm syndrome. But that's what he did. And so that was April. And then now people start talking about the vaccine. It was kind of getting in the news and building a head of steam. And I'm unemployed, so I'm not worried about being forced vaxxed. But at that time, I was taking advantage of free outplacement services. That was part of my parachute package in leaving Comcast. So I was at Comcast for 20 years. And so my resume was like on some AOL saved site, it was antiquated. So I took advantage of like how to make a new resume, to learn what an elevator speech is and what a public exit statement is and how to interview and how to network. And so I had a few telecalls with the counselor, and I always wanted to know how to address mask policy. But I didn't. It's kind of like when you're a kid and you're told, well, don't ask about the break policy or the lunch policy or the pay policy. You're not supposed to come off as petty. You're supposed to like ask how the company's doing and what your future's like. And it's like you're in charm school. And so I did not know how to broach the subject of mask policy. So I just decided to not look for work. And I know that's unusual and it's not a practical a way of handling a situation, but I don't have kids. I don't have a mortgage or a car payment. So I was in a fortunate position to just kind of like put it all on the burner. Meanwhile, people are talking about the jab. And so over the summer, you're hearing more and more people, they're being fired or threatened to be fired. And I think we have a purity right now in attendance. This committee, the people in attendance, I feel there's some intellectual purity here as far as agreement about medical freedom. And so I don't need to tell you what happened. There was the Dartmouth, there was the Concord Hospital, there was St. A's, the Executive Council, the arrests, Nurse Teresa, you all know that. And that, I'm guessing you can consider that already history and on record. So I just have to say that elections, I ran for rep twice. I ran for alderman last year. Election, and I don't. it's not about whether or not voters in Ward 2 like me meaning think favorably of me. They won't even come out to vote for a new mayor. Elections are not secure. And I'm going to say that even though that's not the purview of this committee. So again, the 4 boxes of freedom, things aren't being solved in the court. And you could say that about right to know. I didn't know how to do a right to know. And I wanted to know all these ties that other people with minds greater than mine, investigatively speaking, people in schools that are saying, oh, we can't let the mask drop because of money coming in. And you look like you have a question, but I just have to say before you ask the question that there was only one member of the school board that I voted for, and she was ousted in a recount last election. The chair of the school board called the police on her a couple years ago. I don't have the date. And then she became a rep in Ward 1 herself and is on Children and Family Law. And she went on national TV that she felt threatened by domestic terrorists. So that's the world that Nashua is.
Representative Belcher.
Thank you, Madam Chair. I just wanted to jump in real quick because you had mentioned about this committee understanding a number of things, and they're already part of the record, part of history. But the way this committee operates is we are collecting documents and testimony and making it part of a permanent record that will be a part of this committee and may or may not wind up in a report at the end. But if there is specific items, some of the things that you had mentioned that you want to be considered as a part of a permanent record, you can email any documents you want to this committee and they'll become part of our permanent record.
Okay.
Representative Potenza.
Yeah, so just to follow up on that, there's because the committee does, the committee is 10 large if everybody's here, and for those documents to be part of that permanent record, it would be helpful. A lot of these things that you made mention to, even specific things about Nashua and mask ordinance and all of that was all public record. There's news stories about it, with executive council hearings. So it would be wonderful if you could put that in a document just so that that's all in the permanent record as well about, you could have them as attached as a PDF if you wanted to, not just a link. It would be helpful just in kind of like your timeline with all of those different things that kind of took place. There was a lot of stuff that took place in Nashua, specifically in regards to the mask mandates. It was, I have a friend that it owns a business, and I'm not going to out him, and it was very difficult for him to balance what he was doing. So, because he wanted people to be able to have that freedom, but he also didn't want his business to be shut down. So it was really difficult for a lot of people to navigate that space. And so any information that you have, I would love you to document.
I'd be willing to work with you and put, whatever way you'd like that presented. But I want to thank you for reminding me a couple things I forgot to mention. We had Mask Madness 2.0. So in the fall of 2021, they shoved in like a emergency board of aldermen meeting, and Mask Madness 2.0 went from November until February. And they renewed it twice, and so it was from November until February. And the other thing was that I had the same dentist for 30 years, or almost 30 years, and when Mask Madness expired, the first 1.0, which was like 13 months, so it was like around Father's Day weekend of 2021. I called the office. I said, I understand that, I canceled my appointment and I have to be at the bottom of the wait list. But I do see that City Hall, what happened in City Hall the other night. And I just want to know if I can have an ordinary office visit. Oh, what do you mean? Well, I don't mean to be, I know that your job is to answer the phone and that you don't make policy, but, it's still, masks. I forget what she said, but again, I don't want to come off as like trolling her. I'm like, you mean masks for the dentist and his staff, or do you mean patients in the waiting room? Oh, everyone. I'm like, oh, okay. Well, thank you for answering my question. And I fired him. It was all about the Dental Society Association. It wasn't about City Hall anymore. But the other thing was regarding businesses. We had a business. There was a business called What a Bagel, and What a Bagel was a Nashua native who was a Marine veteran. He was in the Marines and came home from the Marines and opened What a Bagel. And he refused to comply with mask madness. And there was another business in Bedford called Simply Delicious. They're still open. So the two of them, they were harassed by the Attorney General's office. And there's a granite rock material on that. But they quietly dropped the charges against both of these businesses, and I'm sad to say that What a Bagel is no longer in business. He decided not to renew his lease when his lease was up. He's like, I'm out of here, and that's too bad.
When you say they were harassed by the Attorney General's office, what do you mean?
Oh, threats, letters, you're in violation. I have to say, for the record, though, I did not read all the communications, and I wasn't there. But they received a lot of unwanted attention. Let's just put it that way. And it was What a Bagel, and it's owned by it's a family business, a veteran-owned family business, and the family lives in Weir today.
Any other questions? Well, I will state that I can understand the papers. I was given a paper also to carry in my vehicle in case I got stopped, which is crazy. So.
Well, thank you. And I hope I was helpful. I should say as a parting comment that I do want to emphasize what I think a couple of other private citizens said. Hey, I didn't have it as bad. I did not have kids. I don't have kids, so I didn't have kids in the school. I did not get fired. I got the usual rude treatment, and I lost friends, and I was unfriended on Facebook, and so a lot of it was really internal and how I felt day to day. But I feel like I was one of the more fortunate Nashua people.
So do you feel like this pandemic and the response to it created like some mental health anguish for a lot of people?
Oh, most definitely. And again, I'm not a parent, but I hear stories about what it's done to people's kids, and so much that I'm like, I'm there for HB 1093, and I was there for HB 1131, which was vetoed 2 years ago. Kids are the future, and these are our future caregivers, our future government officials, our future doctors, our future media people. So this abusing a whole cohort is going to have fallout for generations to come.
Thank you so much for coming to testify. I
Thank you.
appreciate it.
Thank you. Last one.
Does committee have anything to discuss? Representative Blackus.
As she was talking about the things we all know, the question is, do we have any of that recorded as part of the committee? We all know it, we all remember it, but do we actually have it as part of record?
So I think What we need is, and I think we've received, well, from HHS, DHHS, the COVID timeline. And I believe Representative Belcher put a lot of that stuff already into our record, including a lot of the emergency orders have been printed out in part of our file. But if anyone can think of anything else that may needed to be added, I think, yeah, Representative Potenza.
Yes, so I believe that, and there was more than just those businesses. There were several, and then the legislature passed a bill to remember that to. Okay, I wasn't in at the time, so I do remember that. I think all of those things, the businesses that were affected, notices that went out from the Attorney General's office, because I saw one that my girlfriend got in Portsmouth, so I'm familiar with these, and they were, threats of closure and fines. I believe that every single one of the businesses that received that, every single notice, that should all be public record. And then when, after that bill passed, how it was just kind of all cleared away. I think all of those things need to be in our permanent record. So I will make sure, I have a friend that could possibly do that, but if they don't, then I'll make sure I gather all those materials. I also think it's important because for us to, just because, it was all kind of cleared away through a bill. If 90% of those businesses aren't open anymore, look at the damage of what was done. So I think all of those need to be there to say, to be able to say, okay, well, we need to make sure we don't ever do something like this again.
So, if there's any documents or anything, one of the easiest way, especially if you get the information online, is to email the entire committee. That way it'll go to our assistant and can be put into the permanent record. Representative Blackus.
The other thing she was talking about was the individual city mandates. And I do remember, I had forgotten, but I remember that we wanted to go to, a group of us wanted to meet in Nashua. A group of us wanted to meet in Nashua and go out to a restaurant. And then the whole issue with, we're walking outside near nobody else, but we had to put masks on. And it was, well, we kind of stopped going out to eat in Nashua. But I had forgotten about that until she said it. And so the question is, what was the patchwork of mandates? And as I recall, the only cities who could do mandates or their own health laws were ones that had a health person as part of the city. So like my town couldn't, but Nashua could. So it would be nice to have a record of what was that patchwork and who,
Right. So I can tell you that we do have what we call self-inspecting cities, and they would be able to do their own. We have homestead rule laws and everything else, but because they're self-inspecting towns or cities or municipalities, they get to set their own guidelines, which could be more stringent than the state. Can't be less stringent, but can be more stringent.
I get that. I was just wondering if we had any kind of record of what they did come up with. What was the patchwork like Nashua and their mask mandates which nobody else had to do?
Right. I mean, I think that's would be an interesting avenue to go down, but because we're really looking at the state as a whole, I mean, we can see if someone can get that data for us. But I think our purview is more overall. The Representative Belcher.
Thank you, Madam Chair. And we had just briefly discussed, based on some of the testimony we've heard today, it might be useful to, as a committee, perhaps submit an information request, freedom of, what is it called, 91A type request, to any relevant New Hampshire executive agencies that would have issued warnings, citations, anything of that effect to businesses within the state regarding any of these things?
I think most of that would fall under the purview of the Attorney General, but Representative Wary.
It would be, since we've discussed about the closure of businesses and the loss of businesses from not being able to recover from the economic hardship that those closures caused, it would be good to get perhaps some statistics on the change in small businesses across the chronology of the pandemic, because then I think, since that's one of the things that we're looking at across the state of New Hampshire, it'd be good for us to have a better understanding of that impact. It's tangential to some extent. It's tangential because it's not directly affecting health per se, but or the health of individuals. And I think that's probably often our primary focus. But I think if we're looking at the widespread impact of it, that has a, just as we've talked about the children suffering from ongoing effects of COVID and how it impacted their learning abilities and has derailed their education to some degree because of the impact of wearing masks and not being able to learn speech and things like that. I think there's also a impact due to the closures of small businesses that have never recovered. And New Hampshire has a huge amount of small businesses, so this would be a good thing to understand, because that's something that we need to protect. We're lucky that we have a good, relatively speaking to other states anyway, a good economic environment, but we need to make sure that we don't do things that would threaten that if we encounter a pandemic again.
Right. I just want to remind us, I'm just going to read this real quick, that our areas of particular focus are on the administration of federal guidance, acceptance of federal funds, and the implementation of the emergency use authorization vaccine efforts. So I am wondering how much of the rules that some of these self-inspecting towns, I think, used federal guidance instead of state guidance for, and I guess that is really would be under our purview, because the state not necessarily imposed all of it, but because of federal guidance, as we have heard regarding the education sphere with schools, even though the Department of Education said people could go back to school, they opted to use federal guidance. So, Representative Wary.
Thank you. I think that's really important. And I mean, one of the great hallmarks of the United States is the fact that we are 50 experiments. And when people undermine the experiment that is New Hampshire by using federal guidelines that are not, as we've seen when those were imposed in other states that were more restrictive than New Hampshire, we're no longer participating in that great experiment, and we're causing our citizens in New Hampshire to suffer under the restrictions that are being placed elsewhere. I mean, there are some states that we all know of that were horrific in how they handled this. So, I mean, to understand that aspect is going to be very important.
Representative Potenza.
So to follow up on what Representative Weary had said, I think it's, and we do have a lot of this information. So I'm very familiar, you guys might not be, with it's called Gopher, and it's called the Governor's Office for Emergency Relief and Recovery.
I'm going to interrupt you right now. We are next Friday going to be hearing from Commissioner Caswell, who is the person who was in charge of all those funds.
Perfect. And he's still in place currently.
He is.
Yes. So,
So just so you know, he will be here. So if there's anything specific that you would like to ask him, if you could email so he can prepare, that would be wonderful. So he can be prepared to answer some of the questions.
so we can decide if maybe we put some of these questions in advance, but the documents that I know, some of it will be from Gopher, and some of it will just be through other different, either state or executive, agencies or whatever. But I think it's very important for us to be able to find that information. We find out, of course, who was affected specifically by the pandemic, who is no longer in business. We can get that information as well. And then who received, of course, CARES Act money, which is through Gopher. We can see that. I want all of that information. I think we could get that in advance.
I'm going to interrupt you for a moment, Representative, but I'm going to give you a list. These are questions that have already been sent to him, just so you know. So he's already been sent the following. From the standpoint of COVID-related federal funds, i.e. CARES Act and ARPA, what was the timeline for receipt from the federal government and by the state? What was the decision-making process for distribution by state and by whom? How much money was received and then disseminated? To whom was it distributed by the state? Are you tracking the use of funds? Would you say they have been successfully deployed? Are there measures of success? How are we doing? Those are some of the questions that have already been forwarded to him. Those are the questions that have already been forwarded to Commissioner Caswell in preparation of next Friday's meeting. So if there's anything else on top of that, I didn't mean to interrupt you, but because these questions have already been sent to him, I just wanted to give you, as opposed to duplicative efforts.
No, I think that sounds pretty good. I think the only piece then would be, businesses that, we could get some information. I would like to see kind of like, well, now it's 2024 now, and I'd like to see kind of like where we're at. I mean, in regards with, there's been a lot of anecdotal information. I'd like to really see the numbers of, of what's happening in regards with that.
Representative Weary.
So you never get money without strings attached. So it would be interesting to ask what did the federal government require when providing that money, and whether or not that, what sort of obligations were coming. We have a visitor that WASP has been trying to get. So I think I'm not sure. It could be brought up during the discussion and provided as a follow-up, but it might be good to know, were there any federal government requirements being made because of the distribution of money? Not just, it was not just charity, if you will, but we were then obligating New Hampshire to meet certain conditions, and if so, what were those conditions?
I think the question, what was the decision-making process for distribution by the state and by whom, would kind of go into that a little bit. I mean, but if, like I said, if there's any further questions or anything more specific, just to email me, and we'll get that out. But I just wanted to let everyone know that we are meeting next Thursday, May 16th at 10 a.m. We will have someone here talking about vaccine mandates from the federal level regarding the emergency use authorization. The speaker is named Aaron Siri, for anyone who's interested. We will then be meeting again on Thursday. That's Thursday, May 16th, and then we'll be meeting again on Friday, May 17th. I do have it slated for a 10 a.m. start. Commissioner Caswell will be here at 2 p.m. I was hoping to hear back from Director Buxton from Homeland Security to see if he was available in the morning. If not, I don't know. I can open it up for folks to come in again. I know that there were a couple people. I know there were 2 state reps that wanted to testify today, and maybe they can come next Friday morning to speak with us. So I would ask for them to be available if I do not hear back, and I can send out an email to them. But I just wanted to give everyone I apologized for back-to-back meetings, but the speaker on the 16th was already scheduled before I heard from Commissioner Caswell, and we've been trying to meet with him, and I did not want to change or affect that meeting at all because I think it's extremely important. We will not meet the following week. I think we're going to have a busy week, especially with session. It'd be the week of the 23rd, right, the 23rd, 24th, correct.
Yes, that's the one time I can't make it.
So we will not be meeting that week at all. But anyways, everyone, Representative Wary.
Just one last thing. I know our speaker from Kentucky recommended going to the community to hear public testimony. I know that presents its challenges, but is that something that, maybe this is a rhetorical question right now, but is that something that can be considered? So
I would have to talk with the speaker's office. I don't know if that's something executive council does. I don't know if that's something that this committee would be willing to do. I would have to check with all members, and logistically it could be a little bit of present an issue because they have to be live streamed and recorded. So I don't know how realistic that is, but the fact that we have had now a few people from the public come out and testify, maybe it will give other people courage as we go on. So with that being said, if there's nothing further, I would like to note that we will be adjourned and our next meeting will be May 16th at 10 a.m. Thank you, everyone. Have a wonderful weekend.